Hello and welcome to the Environmental Point of Contact and Green Book training for Naval Hospital Camp Pendleton. You're likely taking this course because you were just appointed as an environmental point of contact for your department or clinic, and you fall under the Naval Hospital Camp Pendleton complex. My name is Lieutenant Marissa Darnell, and I will be providing you this environmental POC training. Just in case I mention it throughout the presentation, I want everyone to be familiar with what the Green Book is. Every department or clinic has a Green Book. It's essentially the hospital's internal environmental program policy and procedures. It touches on regulatory compliance aspects as well as aspects that are just internal and local to our hospital. So if I mention the Green Book, just be aware of what it is, and everyone should have one within their department or clinic. Ask your supervisor if you don't know where it is. So we'll start out with a list of the 4 area topics that this training course is supposed to cover. The training course is required to cover these topics per base and state regulations. So the 4 area topics are, the first one is procedures for handling hazardous waste and medical waste. The second one touches on emergency response procedures in the event of a spill or a threatened spill of hazardous material. The third topic is procedures for the mitigation of release to minimize potential harm to humans or the environment. So how we can make a spill less bad or contain the spill. And the last topic is how to notify hazardous material releases or other emergencies to outside regulatory agencies and to the base. This slide touches on the different categories of waste or the different waste streams that we produce at Naval Hospital Camp Pendleton and the branch clinics. The first category listed there is trash. That's anything that you throw in your garbage can for disposal at a regular landfill. I put no syringes there because syringes are required to be managed as a regulated medical waste, specifically a sharps waste. We'll get more into that on the following slides, as well as provide more examples of items that can be handled as trash versus regulated medical waste. The next category there is recycling. The Green Book kind of provides some guidance on recycling about what you can and cannot recycle. And I've listed there some examples of what can be recycled, including aluminum, plastic, glass, cardboard, and paper. Make sure, please, that anything you're throwing in the recycling bin does not have PII or PHI on it. That stuff needs to be put in like a paper shredder, and the recycling center won't accept anything with personally identifiable information or protected health information. That all numbers note in parentheses behind plastic, that refers to the number within the recycling symbol on a plastic item. There's like a little recycling symbol on plastic items, and it'll have a number on the inside of it. It's like 1, 2, 5, 7. The Marine Corps Base Camp Pendleton Recycling Center actually accepts all numbers of plastic, which is pretty rare because a lot of city recycling municipalities don't even accept all numbers. But Ms. Leah Brown is the person who runs the Marine Corps Base Camp Pendleton Recycling Center, and she basically accepts anything that can possibly be recycled, including shrink wrap. All the recycling bins for the hospital are on the hospital loading dock. There's a white dumpster specifically for cardboard recycling. A contractor picks up the white cardboard, services the white cardboard dumpster, and brings the cardboard to the Marine Corps Base Camp Pendleton Recycling Center for disposal. On some occasions, you may see a metal roll-off on the loading dock. The roll-offs are specifically for metal waste having a 95% or greater metal consistency. So please, 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 if you see a roll-off on the loading dock, don't put random furniture with some metal on it for disposal in those bins. Those bins are for basically metal only. So please don't dump furniture on the loading dock or put furniture in the roll-offs back there. Please coordinate all furniture removal with Housekeeping and Facilities Management Department. Lastly, you'll find some blue 96-gallon recycling bins on the hospital loading dock. The base recycling center goes in and services those bins. And you can actually put paper too in the mixed recycling and cardboard because it's all going to the same spot. It's all going to the base recycling center for sorting. But just please make sure, like I said, that that paper does not have PII or PHI on it when you put it in there. Anything with PII or PHI should go into a shredder for paper. So this is a new policy, so everyone please listen up. Recycling is now going to be instated at the hospital. We have always had the blue bins back there on the loading dock, but we don't have bins throughout the departments. So it's going to be a new thing that we're going to have bins throughout each department. So if you are environmental point of contact at the main hospital specifically, your next task will be to pick up a bin from Mr. Kenneth Hensley. He works in the facilities management department. I provided his email address on the points of contact Word document in the training resources. Please reach out to him and pick up a recycling bin for your department if you work in the main hospital and you are an environmental point of contact. You, as the EPOC at the hospital, will be in charge of this bin, and you will be responsible for servicing the bin daily, at a minimum every other day or so. We don't want any like pests coming and like becoming a problem, eating any leftover waste in the recycling bins. So you, as the environmental point of contact, will pick up a bin. It'll be your bin. You'll be the OIC of the bin. If you want to designate someone else taking it out, that's okay. Just run that by your department head. But the bin is going to be yours. So please coordinate with Ken Hensley to pick up a bin. He'll have a tracker indicating who's picked up the bin and who hasn't. And then you, as the EPOC, will be in charge of that bin and will be responsible for taking it out at the end of each day and as it gets full. So the reason we're reinstating the recycling program was a result of a finding during a recent audit. So it's important that we comply with the findings of that audit and start recycling in the hospital. I don't know if you guys see note 1 right there on the slide, but note 1 refers to food waste. Food waste is currently being disposed of just as solid waste, like general trash here at the hospital. We do have food waste bins on the loading dock, and another finding during the audit was that we weren't using those food waste bins. It's a California Senate bill and also a Mickey West base instruction that requires us to separate organic food waste from the rest of our regular landfill trash. So we will hopefully be utilizing those food waste bins in the near future. So just as an EPOC, just be aware that those bins exist and that we will probably start using them soon. So the rest of the categories of waste, we're going to be talking about those in the following slides. I've kind of color coded them. So the orange color indicates anything that's like a medical waste. Medical waste here at the hospital is handled by a contract. So there's a vendor, it's called Stericycle. They pick up all of our regulated medical waste, our non-hazardous pharmaceutical waste, and all of our trace chemotherapy waste from us from a collection point on the loading dock. It's a Connex box. I'll show you pictures of it later on throughout this training. But essentially everything in orange is taken by this medical waste contractor, Stericycle. The contract itself is actually managed by Naval Facilities Engineering Systems Command Southwest, so it's not local to the hospital. It also covers Navy Medicine Center San Diego. But the environmental program manager at the hospital has this contract and works with the contracting officer's representative to ensure that we're actually getting the pickups as outlined in the contract. So that's everything in orange is handled by that contract, and that all kind of falls under the medical waste category. So everything in orange is medical waste. The hazardous waste down at the bottom and the universal waste, those are kind of grouped into the same category. Hazardous waste includes bulk chemotherapy waste. Bulk chemotherapy waste is chemotherapy waste that has greater than 3% full capacity or full volume remaining. So chemotherapy waste becomes a hazardous waste if it's bulk. That is, if there's more than 3% volume remaining in the container. Universal waste is a subset of hazardous waste that's actually less hazardous, so it's less hazardous waste. Examples of universal waste include batteries, light bulbs, and amalgam. Amalgam would be produced at the dental clinics, and it's considered universal waste because it contains mercury. So I don't know too if you guys can see on the slide where it says pharmaceutical waste, RCRA and non-RCRA. RCRA stands for Resource Conservation and Recovery Act. That's basically the federal law that identifies what a hazardous waste is and tells us how to handle and dispose of hazardous wastes. So we'll talk more about what RCRA is and what makes a pharmaceutical waste a RCRA pharmaceutical waste later on in this training. But please be aware that the hospital Stericycle vendor that picks up our medical waste does not pick up RCRA medical waste. It does not pick up any hazardous drugs. Those hazardous drugs have to be isolated and put in separate bins, and those are actually picked up and dealt with under our hazardous waste management program. The hazardous waste management program is a base regulated thing, completely separate from our medical waste contract. And the base sets our standards for hazardous waste management and disposal, and also takes our hazardous wastes from a final accumulation site for final disposal. So the base is what helps us out with our hazardous and universal waste programs, and everything in orange is medical waste that's taken care of by that Stericycle vendor. So I just wanted to make that delineation between those different waste streams on this slide. It is important to know that hazardous waste is a base program and medical waste is a program handled by that contract with Stericycle. Last thing of note is the 3 significant aspects of the hospital. The color coding kind of also helps with that. So a significant aspect for our purposes, we can say it's like a waste stream. So the 3 significant waste streams at the hospital are solid waste, medical waste, and hazardous waste. So the solid waste is like the trash and recycling at the top. The medical waste is that orange portion in the middle. And then the hazardous waste is the hazardous waste, universal waste, and the RCRA pharmaceuticals, which are all technically falling under the umbrella of hazardous wastes. So those are the 3 significant aspects for the hospital. And the reason I bring that up is just because the Green Book talks about the 3 significant aspects. So that's what that means. It's dividing all these wastes that we produce into those 3 main categories. Okay, regulated medical waste. We've already discussed in the previous slide the trash and recycling categories of waste. This is the 3rd category of waste called regulated medical waste. At the top of the slide there, I have listed some resources for regulated medical waste handling and disposal. These resources are all available under the training resources for this course under the medical waste subfolder. Those bottom 2 resources, Naval Hospital Camp Pendleton Medical Waste Management Plan and the California Medical Waste Management Act, those two instructions or references also discuss management of non-hazardous pharmaceutical waste, because both pharmaceutical waste and regulated medical waste fall under the umbrella of medical waste. So you'll also see those resources listed on the pharmaceutical waste training slides for this course. So defining regulated medical waste. There are 9 primary groups of regulated medical waste, and these are all outlined in that BUMED instruction 6280.1 series. If you're interested, you can go take a look at the instructions saved in the resources. But examples of some of the 9 groups include pathological waste, blood products, used and unused sharps, and trace chemotherapy waste. So Naval Hospital Camp Pendleton doesn't generate all 9 categories of regulated medical waste. So to simplify matters, we divide them regulated medical waste into 3 categories. And those are sharps waste, red bags waste, and trace chemotherapy waste. And just as a friendly reminder from the last slide, trace chemotherapy waste is residual chemotherapy waste. So anything having less than 3% of full volume remaining is considered trace. Anything greater than or equal to 3% of the chemotherapy waste remaining is considered bulk chemotherapy waste, and that will be disposed of as a hazardous waste, which we'll talk about later. That 3rd bullet point down talks about non-infectious waste. So non-infectious wastes would be things like blood-stained bandages, sanitary pads, catheters, diapers, or other bodily fluids like urine, vomit, and feces that do not have sufficient pathogens to cause communicable disease. Because they do not have sufficient pathogens to cause disease, these non-infectious wastes are not handled as regulated medical wastes. Instead, you can simply dispose of all these things in the general trash. That last bullet point there, just a quick point of clarification. I know it says sanitary pads are considered non-infectious waste and can be disposed of in the regular trash, and that is completely 100% okay. But the only catch for that is sanitary pads originating from postpartum suites or from surgical wards. Anytime there's sanitary pads originating from a surgery or something like that, that should be treated as regulated medical waste and disposed of in a red bag. But just like the general containers in the restrooms, those are fine to be just thrown in the general trash. That last bullet point talks about interim versus final regulated medical waste storage areas. So I mentioned before that there's a Connex box on the loading dock where we put all of our regulated medical waste for disposal and pickup by the waste contractor Stericycle. So that's the final one, the final accumulation area for regulated medical waste. And each department that produces regulated medical waste has an interim storage location. So we'll look at a picture of a door that identifies an interim regulated medical waste storage area. We'll look at that later in this training, but just know that within your department, if your department produces regulated medical waste, you likely have an interim storage location where you leave that regulated medical waste for pickup by housekeeping. And housekeeping brings, at the main hospital, housekeeping brings the regulated medical waste from the interim storage area down to the Connex box on the loading dock. At the clinics, the transportation department services the interim regulated medical waste storage areas, and the transportation department, which is a sub department beneath facilities, they pick up the regulated medical waste from the interim locations of the clinics and then also bring it to the hospital Connex box for final disposal. As promised, here is a picture of the Connex box on the loading dock that serves as the regulated medical waste final storage area. It's that middle Connex box in that first picture on the left. If you can see, there's a little red sun-damaged sign on the Connex box. The verbiage on that sign is actually per San Diego County's Department of Environmental Health and Quality. So the verbiage on that sign is a county requirement. And basically we need to get that sign replaced because it's encountered quite a bit of sun damage, as you can see. So the housekeeping operations and management department is currently working on replacing that for us. The picture on the right there is what is happening inside the Connex box. So all the red bins there are those are where your red bags waste will go. The yellow bins are where the trace chemotherapy waste will go. And then those grayish / whitish blue bins in the middle, that's where all the pharmaceutical, the non-regulated, non-hazardous pharmaceutical waste will go. Anything hazardous or anything managed under the Resource Conservation and Recovery Act is considered a hazardous pharmaceutical, and that will never, ever, ever, ever go in the Connex box on the loading dock. So the Connex box in the loading dock, that's the picture there, outside and inside. And we'll also discuss further on in this training that anytime a regulated medical waste bin is not in use, you should close it. Anytime any bin isn't in use, you should close it if there's something inside of it. So provided that all those are empty, it's okay that they're open, but it does look like there's some that are open with stuff in them. They should be closed. If they have stuff in them and they're not currently in use, you should close them. So this slide talks about sharps. A couple slides ago, I mentioned that there are 9 categories of regulated medical waste, and for the purposes of simplification, the hospital says that there are 3. Sharps is the first of those 3 categories of regulated medical waste. So sharps is as it sounds. It's anything that has the capability to puncture or cut your skin, regardless of the presence of infectious agents. So examples of sharps include hypodermic needles, syringes, scalpel blades, blood collection tubes and vials, because those have the capacity to break and hurt people, test tubes, culture dishes, dental burrs, etc. You can read the list there. Syringes, as I've mentioned before, have to go in the sharps bins whether or not they have a needle. It's a DHA and BUMED policy that we manage syringes as sharps. So please put all the syringes into the sharps bins, provided that they're empty. Okay, so Disposal of sharps. How do we dispose of sharps? We have to use a rigid puncture-resistant, leak-proof, closable red bin. We also have wall-mounted sharps containers that have a red or clear bin insert. And we'll see pictures of those on the next slides. For every type of medical waste and hazardous waste has a storage limitation. For sharps, we require the sharps bins to be taken out of the workspace if they're 3/4 full, or if they're reaching the full line on the wall-mounted sharps containers, or if they stink. That's what putrescent means. If they stink, you got to take them out. Once you close the bin and place it in the regulated medical waste interim storage area for pickup by housekeeping or transportation, you can leave it there for up to 7 days. And that's per that DHA instruction that I listed under the resources on the introduction to regulated medical waste slide. The DHA instruction tells you that you can only leave stuff sitting in that interim storage area for 7 days. So at the workspace, you can leave it there basically indefinitely unless it becomes 3/4 full, reaches the full line, or is smelly. Once you take it from the work area, you're going to close it, wrap it up, put a close date on it, and then it's allowed to sit there for up to 7 days before you take it to the final regulated medical waste storage area for pickup by the Stericycle vendor, and that's the Conex box. Labeling requirements for sharps are listed there. So it has to have the universal biohazard symbol with the word biohazard on the lid and sides of the container. Please take note of lid and sides. The county requires us to not only have the biohazard label with the biohazard symbol on the side, but it also has to be on the lid of the container. So if it's not, your supply petty officer needs to be purchasing extra biohazard stickers to put on the lids. The bins also have to have the department or clinic name, the address label of the hospital or the clinic, wherever the waste is produced. It would be the address label for that location. And when you close the bin, when it's full or stinky, you have to write the close date when the bin is closed. So you're going to write the verbiage closed, CLOSED, on the bin with the date. The address label includes a phone number, and that's also per county regulation. So make sure that whatever address label that your supply petty officer is ordering for your clinic, it has the phone number there at the bottom. So here's some examples of the sharps bins, as I said we were going to see. So the one furthest there on the left, that's a sharps bin insert. So that's one of the bins that goes inside the wall-mounted sharps container. So the wall-mounted sharps container opens up, and then this bin insert can be pulled out. So this bin insert has to have, the bin insert is what has to have all the required labeling, because the bin insert is what's being pulled out and taken for disposal by the vendor. So it has to have that universal biohazard sticker, the department or clinic name with the address label, and the close date. So the one in this picture is missing the close date, so they should have marked it as closed, CLOSED, with the date. And you can also see too, it has an incineration only date. That sticker should not be on there. That sticker is for pharmaceutical waste, and sharps bins should not have an incineration only date on them. The taping is pretty much good. We'd recommend taping twice around the whole bin to just ensure that the bins don't open. But the lids do snap, so they should be prevented from opening anyway. But as good measure, wrap the tape around twice. Also, sharps bins should be secured from tipping over. So don't just set one of those wall-mounted sharps bins inserts on a table and use that, because it can easily fall over. The bin, those little inserts, like the one shown in that left-hand image, those should only be used inside those wall-mounted outer containers. Those shouldn't just be used on tabletops. So just keep that in mind. That middle picture right there, that's a cart that you can place a sharps bin in. Those carts are best practice. It's better to put a sharps bin in that cart than just set it on the floor, because sharps bins have to be protected from falling over, essentially. So please have your supply petty officer order that cart to put the bins in, to prevent the sharps bins from tipping over when they're out on the work area floor. That little hangman arm in the center will actually keep the sharps bin closed when it's not in use. So that should also help satisfy that requirement with keeping the containers closed when they're not in use. The furthest image on the right shows a sharps floor bin within that little cart as recommended. It's left open. I don't know why. It doesn't look like that cart has one of those hangman arms to keep it closed. So those should be closed at all times if there's sharps inside and they're not in use. That bin in that right-hand picture is also missing the biohazard sticker on the lid. It only has one on the side of the container there. And it should also have an address label, which we also call a generator label. It's also missing that. Another point I should mention is that those inserts, those don't necessarily need to have that biohazard sticker on the lid. That's only for the floor bins. So that left-hand image, that biohazard sticker that's on the front, that's sufficient. You don't need another biohazard sticker on the lid. I provided a couple more pictures on the slide for your understanding. On the previous slide, I talked about not using the sharps bin wall-mounted container inserts on tabletops. So that's what that picture is kind of showing. That clear sharps bin on the left is supposed to be inserted in the wall-mounted container, and that department is using it just as a tabletop sharps disposal bin. Please don't do that. Instead, use the bin on the right-hand side that's turned upside down. If you're going to use that bin, however, on the tabletop, it's got to have a generator label. It has to have the universal biohazard symbol with the biohazard verbiage on the lid, and it has to have a lid that's a closable lid for when you're not using the container. So I also want to mention too, both of those bins have a fill line. It's like a line with a double-sided arrow right above that universal biohazard symbol. That line indicates to you when your sharps container has reached 3/4 full. So when it reaches that line, that's the point at which you have to remove it from your workspace, or if it's smelly, you got to remove it then too. But if it reaches that line and it's still in your workspace, remove it from your workspace at that point, tape it up 2 times around, write closed on it with the date, and then drop it in the interim regulated medical waste storage area inside a red bin. And from there, it has to be picked up within 7 days. So housekeeping is supposed to be picking up daily. They do pick up daily, but a lot of times you'll have to call them to let them know that you would like things picked up. So just keep track of those close dates and make sure they're not exceeding the 7 days within your interim storage areas. The address label that I mentioned, that little upside down red bin is missing an address label. Under the training resources, there's a command address label for the hospital. Please look at that. If you're a supply petty officer at the clinics and you're ordering address labels for your clinic, please follow that same format that's in that template saved for the hospital. So just to reiterate, that's under training resources. The title of the document's called command address label. So please just take a look at that if you're a supply PO for the clinics, and make sure you follow that same format for the address label, because the county requires us to follow that format and have that phone number on there. In that right-hand picture, that's just an example of a syringe thrown in the trash. Like, it looks like it's fine, right? There's no needle on it, but it's not fine. DHA and BUMED want us to put it in the sharps bin. So pretty please just make sure you take note of that and put any syringes, even the ones without sharps, in sharps bins. Okay, so we just finished talking about sharps waste. Before we move on to this next category of regulated medical waste, I just wanted to quickly note that I was talking about the sharps insert bins that go into the wall-mounted sharps containers. You have to mark those with the word closed and the date that they're closed. Keep in mind that you also do have to do that for the floor sharps bins that you put in the carts. When they're reached 3/4 full or they're smelly, you have to close them. Still mark it closed with the close date before you put it in the interim storage area for pickup by either housekeeping or transportation if you're at the clinics. So just wanted to throw that out there. The same labeling requirements apply to the floor sharps bins as the wall-mounted inserts. Okay, moving on to the second category of regulated medical waste, which is the red bags waste. Examples of red bags waste include cultures, blood and blood products, absorbent materials that are saturated with blood or bodily fluids, pathological wastes, which includes tissues, organs, and body parts, and potentially infectious wastes generated during patient care. So that'd be like something like spinal fluid, saliva, or other body fluids. If you have reason to believe that it could be infectious, like it came from an infected patient, then you'll dispose of it as a red bag waste instead of a non-infectious waste through the general trash. So where to dispose of regulated medical waste that falls into the red bags category? You're going to dispose of it in goosenecked and taped closed red bags. These red bags have to be doubled if it's like a liquidy solution or a really bloody saturated solution. Or yes, please double them so they don't leak if there's a lot of liquid in the red bag. And then once you've goosenecked and taped closed the red bag, you're going to put it inside a red bin in the workspace. So for pathological waste, you have to store all that kind of stuff in a designated refrigerator at the interim storage area. Really, no departments besides the main operating room should even possibly be producing pathological waste. But in the case that you work in the main OR and you produce pathological waste, just know that you have to store it goosenecked in a gooseneck tape closed red bag inside a designated refrigerator. And you have to get it removed from that interim storage area within your local refrigerator within 1 day. So call housekeeping if you have pathological waste. They should pick it up and transfer it to a central freezer, which is located in the morgue at the main hospital. So don't let pathological waste sit longer than a day in your local refrigerator within your department at the main OR. The storage limitations for general red bags waste, like excluding pathological waste, at the work area, there's really no storage limitation. Just don't be nasty, guys. Don't let like red bags waste be sitting so long that it starts stinking within the work area. Like, please remove it before it starts stinking, like a couple of days, depending on what the waste is. It's better to just get it out of the work area sooner rather than later before it starts stinking. But technically, there's no hard requirement about removal within a certain time frame. However, there is a requirement for removal from the interim storage area once it's dropped there. So once you empty your worksite red bin, gooseneck, tape the red bag and put the date on it and put it in the interim storage area, it has to be taken out of that interim storage area within 7 days. Or if it stinks before 7 days, it's got to go before 7 days. So labeling requirements on the red bags themselves, there's lots of labeling requirements. You have to have the universal biohazard symbol, the department clinic name, the address label, which includes the phone number, 2 ASTM certifications, and the date that the red bag is sealed and placed in the red bin. So on Camp Pendleton, the warehouse stocks red bags for us, and these red bags are already pre-populated with the address label, including the phone number, and the ASTM certification labels. So when your supply petty officer for your department or clinic is procuring the red bags, order them through the warehouse central supply. Because the warehouse already, if you're on Camp Pendleton, you're an EPOC at both the hospital and clinics, please order the red bags that are centrally stocked at the warehouse on Dimmels, because those are already having the proper address label for the hospital and the certification labels. When you tie up a red bag, gooseneck it and tape it closed, you need to put the name of your department or clinic and then the date that you sealed that bag. For red bins, those have to have universal biohazard symbols with the word biohazard. So that sticker we were talking about for the sharps bins, the same thing. And it has to go on the lid and the sides of the red bin. The bin also has to have the address label. If you're at the main hospital, you can use the address label that's saved under the training resources, the department clinic name, and the start date of use or placement in the regulated medical waste storage area, and the close date when the bin is closed. So essentially all these dates are just to make sure that the regulated medical waste doesn't sit in the interim storage area for longer than 7 days. So when you place something in the storage area, you put the start date. So like if you're taking a bag from the work area and you're placing it in the interim storage area, you'll put the date of that placement on the red bag. If you take a bin from your work area and you close it and place it in the interim storage area, put the date on that bin that you're placing it in that interim storage area. Because we essentially want to just make sure that stuff isn't sitting in the satellite accumulation, in the interim regulated medical waste storage area for longer than 7 days. So anytime you place a new bin in the interim storage area for eventual pickup by housekeeping or the transportation department, put that date on there. That's what that date's for, is for tracking how long it's been in the interim storage area. So you only really need 2 dates if you have a bin that's sitting in the regulated medical waste interim storage area and you're putting more red bags into it. So for instance, you have a large red bin in the regulated medical waste storage area, and throughout multiple days, you'll be disposing red bins in there as they're produced. So in that case, you have to have a start and end date. So the start date would be the date that you put it in the regulated medical waste storage area and started putting bags in it. That would be the start date. The close date must be less than 7 days from the start date, and that's when you closed it and sent it off with housekeeping for disposal in the Connex box, or for placement in the Connex box for pickup. So the bags, since they're the start date, the placement date in the regulated medical waste interim storage area is going to be the same as the close date of the bag. You only need 1 date on those. For pathological waste, it's important that we separate pathological waste from other red bags waste, because pathological waste needs to be incinerated. So on any bag or bin containing pathological waste, you have to write path or pathology waste on the bag. And if it's a container, write it on the lid and the sides of the container. That'll notify the housekeeping that they need to keep that waste separate from the rest of the red bags waste. So don't put pathology or pathological waste in the same red bin as other general red bags waste. Okay, so we're going to go through some pictures to enhance understanding. So the leftmost picture there is a red bin that's placed in the work area. It's correctly lined with a red bag. Please make sure all your red bins are lined. We don't want to see any unlined red bins because they get all nasty inside, and the bag prevents any liquid from blood saturated products like leaking down into the actual bin. So they all have to be lined with the bag that has the proper ASTM certification, because that bag will prevent any leakage into the actual bin. So that bin pictured on the left properly has biohazard labels with the universal biohazard symbol on the lid and the sides of the container. However, we could use to replace those because they're kind of falling off a little bit. It is lacking the department clinic name and the address label. So I think that picture was taken in the laboratory. So if you have any bins missing the address label, please stick that on there somewhere along with your department or clinic name. So this bin is in the workspace, this red bin's in the workspace. So there's no start or end dates of accumulation because this bin is only remaining in the workspace for workspace accumulation. So when you take that red bag out of that bin, you're going to gooseneck it, tape it up, close it. You're going to write the department name on it and the date, and then you're going to take it to the interim storage area for drop off into the communal red bin in the interim storage area. And it has to be removed from that interim storage area within 7 days. So that second picture is an example of a red bin in the interim regulated medical waste storage area for the laboratory. So this is like a permanent red bin, guys. Housekeeping will come and take the red bags out of that bin, So that bin just stays there for gathering the red bags. So that'll never be tied up or closed or having a start and end date of accumulation, because the bins are simply, the closed red bins and the closed red bags are simply taken out of there. So as I mentioned before, if you have a red bin in the interim storage area that you use to deposit red bags on different days, or closed red bins across multiple days, and you eventually will close that bin, you should put a start date on that bin for when the first bag was put in it within the interim storage area. That'll track like the beginning date of when you started putting closed red bins or red bags in there. So that's the start date that it began accumulating waste in the interim storage area. And then when you close that red bin, you want to put the close date of accumulation in the interim storage area, not to exceed 7 days from the start date. And then at that point, housekeeping has to remove that bin as well. So that start and end date policy on the bins only applies if you are collecting regulated medical waste across multiple days within the interim regulated medical waste storage area. If you're just closing them and putting them in the interim storage area for disposal, it only needs to have one date, because the close date and the date it was placed in the storage area are now the same. So I hope that that's clear. If anyone has questions, just ask your EPM. But basically, just don't let stuff sit longer than 7 days in the interim regulated medical waste storage area. That third picture from the left is a picture of signage on an interim regulated medical waste storage area door. The signage verbiage, like I said, is per the county. The DHA instruction, the 6050.01, which was listed under resources, that instruction says that the signage identifying interim regulated medical waste storage areas needs to just say regulated medical waste. So what we have is fine because it meets the county standards, but just bringing that to your attention, if you were confused by what the DHA standard says, it says the doors need to be labeled regulated medical waste. We're just going by the county standard instead of the instruction. Either way, it would probably be fine if we did the DHA regulated medical waste signage instead. That would be fine, but we're opting to use the county verbiage and sign for those doors. The picture, just for everyone's awareness too, please keep interim regulated medical waste storage areas locked and with the doors closed. We don't want unauthorized personnel entering those spaces. That's a requirement per a couple of those resources listed. On the picture at the far right, the bag that was procured is the correct bag. It looks like it's the Camp Pendleton bag with the address labels and the ASTM certification. So it looks to be the proper red bag. However, please, please, please line the red bins. Don't just leave the bag draped outside the bin like that. And please ensure that the bin also has an address label. Moving on to the last category of regulated medical waste, which is trace chemotherapy waste. So as previously discussed at the top of the slide, the top of the slide distinguishes between trace and bulk chemotherapy waste. So in any chemotherapy waste having 3% or greater of its full volume remaining should be treated as a bulk chemotherapy waste, which is a hazardous waste, not using the disposal procedures on this slide. So any materials also used for chemotherapy spill cleanup should be managed as bulk chemotherapy waste. So trace chemotherapy waste is essentially like residual chemotherapy waste. So that would include any needles, vials, syringes, gloves, gowns, and tubing that contained chemotherapeutic pharmaceuticals or were exposed to chemotherapeutic pharmaceuticals during treatment of patients or in the pharmacy when they deal with chemo drugs. Any gloves that they use during that process would be trace chemotherapy waste. And trace chemotherapy waste, as I mentioned before, is classified as empty or less than 3% of full volume remaining. So in the training resources under the medical waste subfolder, I have provided to everybody the Naval Hospital Camp Pendleton hazardous drugs list. So that hazardous drug list identifies chemotherapy drugs, and it also identifies any hazardous drugs that we use here at the hospital. So everything in yellow on that drugs list is a chemotherapy drug. It may be treated as a trace or bulk chemotherapy waste depending on the volume remaining. So that hazardous drugs list also contains other hazardous drugs that are not chemotherapy drugs, and those would likely be managed as hazardous drugs with the black bins, which we're going to talk about later. That list can help us identify which drugs are hazardous and which aren't, so that we know anything on that list cannot be disposed of as a non-regulated pharmaceutical waste. And we'll also talk about disposing of non-regulated pharmaceutical waste right after this. So trace chemotherapy, where to dispose of it? You're going to use rigid, puncture-resistant, and leak-proof yellow bins lined with yellow bags of non-sharps. So obviously if they're sharps, you're not going to want to use the bags because the sharps are going to puncture the bags anyways, in which case you'd put everything just directly into the bin. The storage limitations for chemo waste are outlined here. You can only use the yellow bins for up to 9 months or until 3/4 full. So just be proactive. If something's about to reach 9 months, make sure to call housekeeping to get rid of it so it can be placed in the Connex box for pickup by the vendor. Labeling requirements for the trace chemotherapy waste bins. For the bins, they have to have the biohazard symbol, the address label. They have to have the verbiage trace chemotherapy waste or trace chemo waste on the lid and the sides of the container, the start date of accumulation, and the close date when the bin is closed, because you want to make sure that you're not using the bin for longer than that 9-month period, which is per the BUMED instruction. Yellow bags have the same labeling requirements as red bags, so they have to be have that ASTM certification and everything as well. So here's some pictures of the trace chemo waste bins and bags. On the left, there's a typical trace chemotherapy bin. As you can see, it has the universal biohazard symbol. You would also need to stick an address label on there and write trace chemo waste on the lid and the sides of the container. You would also want to indicate the start and end dates of accumulation to ensure that you're not exceeding that 9-month period required by the BUMED instruction. If it becomes 3/4 full before 9 months, you also have to get rid of it at that point. Since trace chemotherapy waste is a regulated medical waste, again, please don't let it sit in the interim storage area for longer than 7 days. That picture on the right shows the interim regulated medical waste storage area for chemotherapy waste for the pharmacy department at H200. The bins are taped closed. That's good practice. You probably want to do that with your red bins and sharps bins as well. Just when you close them, put some tape across them to prevent them from opening again once they're officially closed. They should also be labeled with trace chemo waste on the lid and the sides, and have the start and end dates of accumulation marked. Just to emphasize this, the pharmacy and maybe some of the pharmacy departments at the clinics would be really the only ones producing trace chemo waste. You likely won't have any in your department, but I'm just including this for all EPOC training so everyone's aware of the general labeling requirements and requirements for disposing of trace chemo waste. Congratulations. So we finished talking about regulated medical waste. That was the sharps, the red bags waste, and the trace chemotherapy waste. We're now moving on to the next distinct category of waste, which is pharmaceutical waste. Right now, particularly for this section of the presentation, we're going to talk about non-regulated pharmaceutical waste. So non-regulated pharmaceutical waste is any non-chemotherapy, non-hazardous pharmaceutical waste. And when we say non-hazardous, I'm talking about non-RCRA. So RCRA, Resource Conservation and Recovery Act, that's the federal standards essentially for identifying hazardous wastes. So if a pharmaceutical waste meets the definition of a RCRA hazardous waste, it is considered a RCRA pharmaceutical waste. And I believe I mentioned this earlier in the training. So California actually has more stringent hazardous waste standards than the federal government. So it has more stringent standards for identifying hazardous wastes than the EPA. So California has a classification of waste called non-RCRA hazardous or non-RCRA California hazardous, meaning that the pharmaceutical waste meets the California definition of hazardous waste, but it does not meet the EPA or federal RCRA definition of hazardous waste. So for the purposes of pharmaceutical waste, pharmaceutical waste is considered RCRA, chemotherapy, or non-regulated. And the California hazardous waste, or the non-RCRA hazardous waste, falls under the non-regulated pharmaceutical waste category. So any hazardous pharmaceutical waste that meets the definition of California hazardous, but not EPA hazardous or RCRA hazardous, is technically non-regulated pharmaceutical waste. So that is per county regulation, that is per county standards. So I just want to make everyone aware of that distinction, that there's three types. There's three types of pharmaceutical waste. There's the federal government RCRA definition of pharmaceutical hazardous waste. There's chemotherapy pharmaceutical waste. And then there is the non-regulated pharmaceutical waste, which embodies the California hazardous, but non-RCRA and non-RCRA hazardous. Therefore, RCRA pharmaceutical waste, meeting the federal hazardous waste definition, will be handled and disposed of via the hazardous waste slides that are going to follow this section of the course. Chemotherapy pharmaceutical waste will be handled as either trace or bulk pharmaceutical waste, depending on the quantity remaining, as discussed during the trace chemotherapy slides. And then the non-regulated pharmaceutical waste will be managed as explained on this slide. So there's a lot of overlap between the pharmaceutical waste and hazardous waste programs. Like I was previously trying to say, I'm trying to hit home that the non-regulated pharmaceutical waste does include California only hazardous pharmaceutical wastes, but it does not include the RCRA federal defined pharmaceutical wastes. So I hope that's clear. Again, if you have any further questions, please just ask your EPM. A lot of times, most departments won't be dealing with a lot of RCRA pharmaceutical waste anyway. But like I said, if there's any ambiguity, just ask the EPM. So at the top here, I've listed some resources. The first resource, the BioMed instruction, talks about pharmaceutical waste in general. So it also addresses not only handling and disposal of non-regulated pharmaceutical waste, but it also talks about disposal of RCRA drugs and chemotherapy drugs, either trace or bulk. So that 9-month requirement for that 9-month limitation for storage of trace chemotherapy waste actually comes from that instruction. The Naval Hospital Camp Pendleton Medical Waste Management Plan and California Medical Waste Management Act, again, touch on non-hazardous pharmaceutical waste handling and disposal. So a non-regulated pharmaceutical waste is a non-regulated pharmaceutical waste is a non-chemotherapy, non-RCRA pharmaceutical that must be wasted out. And the reason it would have to be wasted out would be that it's like partially used or open and expired, or it has like fallen on the floor or something like that. So please keep in mind that pharmaceutical waste does not include any unused, unopened pharmaceuticals. These unopened, unused pharmaceuticals, even if they're expired, may be eligible for the reverse distribution. So anything unopened, unused, and in its original packaging is not a waste, guys. The reverse distribution program is managed through the pharmacy. The current point of contact is Fred Caballero. He coordinates with the reverse distributor to return unused, they're usually non-expired pharmaceuticals to a vendor, and the vendor like makes money on this program. Usually the pharmaceuticals aren't expired, but on a case-by-case basis, they will accept expired ones. So if you have any unused pharmaceuticals in your department, whether or not they're expired and you're trying to get rid of them, please coordinate with the pharmacy department to see first if the reverse distributor will accept them. Per the Department of Toxic Substances Control in the state of California, they prohibit sending any RCRA or hazardous pharmaceuticals back to the reverse distributor unless the reverse distributor is permitted as a hazardous waste treatment, storage, and disposal facility. Our particular contract does have a hazardous disposal line item number. So our contractor can accept hazardous RCRA pharmaceutical waste, unopened pharmaceuticals on a case-by-case basis, and that would all be decided by Fred and the vendor. So please, if you have any questions, reach out to Fred Caballero in the pharmacy department. His contact information is provided in the Word document under the training resources for the environmental program contacts. A couple examples of non-regulated medical waste would be like IV, full or partially full IV bags containing added medications. In that case, you would just put the unpunctured IV bag just in the blue and white bin. Non-regulated pharmaceutical waste is placed in blue and white bins and is disposed of using the same contract as the regulated medical waste, which we just discussed in detail in the previous slides. Just to reiterate from the previous slide, a non-regulated pharmaceutical waste is any pharmaceutical that's not a RCRA pharmaceutical and that's not a chemotherapy pharmaceutical that needs to be wasted out. So as a rule of thumb, it's anything at Naval Hospital, it's any pharmaceutical that needs to be wasted out at Naval Hospital Camp Pendleton that does not appear on the hazardous drugs list. The hazardous drugs list, again, as I've said before, is provided in the training resources under the medical waste subfolder. So anything on that list will not be disposed of as non-regulated pharmaceutical waste. Also keep in mind that in order for it to be considered pharmaceutical waste, it must be opened and expired or partially used. We're not going to treat anything as waste that's unopened or unused and in its original packaging. So anything in its original packaging, that is unused and unopened, please coordinate with the pharmacy first before wasting it out. The pharmacy will not be responsible, however, for wasting out your expired drugs for you. If the reverse distributor will not accept the unused pharmaceutical, whether that be because it's expired or it's just something that doesn't fall under their program, you will be responsible within your department for wasting it out. But please just check with the pharmacy first if the unopened pharmaceutical is eligible for reverse distribution. Okay. Any unused vaccines need to be coordinated with preventative medicine, not the pharmacy department. Just putting that out there. And pharmaceutical waste also, non-regulated pharmaceutical waste does not include any electrolyte solutions, saline solutions, or glucose. So if you have any IV bags containing like electrolyte solutions, saline solutions, those can be just cut and emptied in the sink, and those can just be thrown in the regular trash can. So non-regulated pharmaceutical waste includes any pharmaceutical that's already open, already partially used, that's not on the hazardous drugs list, and it would include like IV bags with added medications. As a side note too, for anyone who might be randomly curious, if you've seen those MedSafe, almost like blue mailbox looking containers outside the pharmacy pickup windows, those are for patients to return any like partially used prescription pills or other prescriptions that they've received from their doctor. That's actually a third completely separate thing. It's separate from reverse distribution and it's separate from regulated or non-regulated pharmaceutical waste. So it's like a third separate contract. So just FYI, in case anyone was curious, that doesn't fall into the reverse distributor or pharmaceutical waste category. That's like its own separately managed thing. And I believe the pharmacy department also holds that contract if anyone ever had questions about it. Like I said, anything unopened, even if it's expired, and unopened, even if it's a RCRA pharmaceutical, if it's not a waste yet, please, please, please speak to the pharmacy department to see if it's eligible for refuse distribution before wasting it out. Okay, so that finally brings us to the content on this slide. So if it falls into the non-regulated pharmaceutical waste category, it's been opened, it's partially used, you need to get rid of it, or the pharmacy can't accept it through their reverse distribution program and we have to now waste it out, this is what we do. Okay, so we dispose of non-regulated pharmaceutical waste in blue and white floor bins or wall-mounted pharmaceutical waste containers. So again, on the next slide, we'll see a couple of pictures of what each of those looks like. You're probably already familiar with what they look like if you use these containers in your work area. The storage limitations for non-regulated pharmaceutical waste are as follows. Bins must be closed within 1 year from the first use. So for the start date of accumulation, you'll write the date that you put the first pill or the first pharmaceutical waste item in the container, and they have to be closed within 1 year of that start date. Or when they're 3/4 full, so whichever one comes first. The labeling requirements for the blue and white bins include a for incineration only label. Again, per the county, the label has to go on both the lid and sides of the container. The address label. For the hospital, you can just stick on the one that I provided in the training resources, which includes a phone number, and the start date of accumulation and the end date of accumulation, or the close date when the bin is closed. The close date, importantly, cannot exceed more than 1 year from the start date. That's per state, per everything regulations. So just be aware that you can only use these bins for up to 1 year before they have to be closed. So sharps can be placed in non-regulated pharmaceutical waste bins, but it can't go the other way. You cannot ever place non-regulated pharmaceutical waste in a sharps bin. The reason is because sharps are treated via autoclaving, whereas non-regulated pharmaceutical waste is treated via incineration. So incineration is like burning, and you can also dispose of sharps via incineration, but you're not allowed to dispose of non-regulated pharmaceutical waste via autoclaving. So it's a one-way street. You can put sharps in the pharmaceutical bins, but you can't put the pharmaceuticals in the sharps bins. If you are using a pharmaceutical waste bin for sharps, which is not necessarily best practice, however, you can do it, but if you are doing it, you need to make sure to put a biohazard sticker with the verbiage biohazard on that pharmaceutical waste bin. And that'll indicate that sharps and pharmaceutical waste are both going into that bin. And it'll be treated with incineration, and therefore will have the for incineration only label. Lastly, any like non-empty syringe or needle used to administer a non-regulated pharmaceutical, those need to be disposed of in the pharmaceutical waste bins. Don't put those in sharps bins because they have residual liquid that's a pharmaceutical waste, okay? So don't ever put any liquids in sharps bins because those liquids are pharmaceutical waste. Okay, pharmaceutical waste pictures. So I like this picture on the left because there's a lot we can talk about here. So first of all, that blue and white bin on the floor is an example of a non-regulated pharmaceutical waste container. It's closed, it's open, which is actually out of compliance because all containers when they're not in use need to be closed. If you remember during the sharps section, I discussed those little carts that you can place these bins in. I would recommend also using those same carts for these pharmaceutical waste containers, these blue and white ones. They have that little hangman arm that'll keep the container closed when it's not in use. It doesn't matter that the carts are red, you can still use them for the blue and white pharmaceutical waste bins. So please have your supply petty officer order those if you feel like that's something that you need. It's good practice as opposed to just having the bins on the floor and like able to fall or spill. So this bin here is actually, other than being opened when it's not in use, which is a violation, it's actually properly labeled. On the back of the bin there's the for incineration only label. It has the start and end dates of accumulation on the front right there. And then there's also an address label on the back of the bin. So It's honestly up to you as the EPOC within your department if you want to put the end date of accumulation, if you want to populate that date in advance. Usually we recommend just putting the start date and then only adding the end date when you actually close the bin. But if you want to populate them both at the same time with the end date of accumulation 1 year out, you can go ahead and do that. But please just make sure you keep track of those bins and make sure those end dates aren't being like exceeded. So as long as you remove it from the storage area and close it properly, as long as you remove it from the work area and close it within 1 year, it doesn't really matter when you fill that end date in, is what I'm trying to say. So also in that picture, there's some RCRA pharmaceutical bins. So those are for pharmaceuticals that are on the hazardous drugs list. So that's why those bins are black. And we'll get into labeling requirements for hazardous wastes and RCRA pharmaceuticals later in this lesson. Again, all bins, regulated medical waste bins, pharmaceutical waste bins, hazardous waste bins, all of them have to be closed when they're not in use. That picture on the right shows a wall-mounted pharmaceutical waste, non-regulated pharmaceutical waste bin. Just as for the sharps bins, those non-regulated pharmaceutical waste wall-mounted bins have like an insert that goes inside the bin. So you'll pull out the insert when it's time to take that bin out and send it to the Connex box. So that insert on the bin is what has to have all the required labels, like the start and end dates of accumulation, the address label, and the for incineration only label. That bin in particular has a biohazard label because it's in the emergency department, and the emergency department puts all their sharps in their pharmaceutical waste containers. So that's why it has the biohazard label on it as well, is because sharps are being placed in there. In general, it's best practice to have separate bins for pharmaceutical waste and for sharps waste, but it's in compliance with all regulations to do it this way. The reason we encourage separation is just because incineration's an expensive process, so it makes more sense to separate the waste streams if we can. Really quickly, since we just went through the labeling requirements for regulated medical waste and non-regulated pharmaceutical waste, I want to bring to your attention the document titled Waste Disposal Chart under the training resources. That chart is essentially like the Bible that outlines the labeling requirements and storage duration limits for each type of waste that we've already discussed within this training and that we will discuss within this training. So it might be helpful to pull that up and just have it side by side this training and just kind of see a summary on that chart of everything we're discussing. This slide talks about medical waste logs. The left side shows a medical waste pickup log at one of the clinic interim regulated medical waste storage locations. So this is essentially a log that the transportation department representative would fill out when they pick up regulated medical waste from the branch clinics. This is not a hard requirement by any of the DHA or California requirements. It's not a requirement to have these logs at the interim locations. However, it is hospital policy that we maintain these logs, and we don't have a template for them. So, but at a bare minimum, make sure they include the name of the person picking up the medical waste, the date the waste was picked up, and the number of containers that are being picked up. So that's the minimum requirements for the information that must be included on these interim regulated medical waste pickup logs at the clinics. So if you're a clinic environmental point of contact, you can make your own log, but just make sure that it has those three things: the name of the person picking up the waste, the date of pickup, and the number of containers picked up. On the right side is the regulated medical waste drop-off log at the final storage area, which is the Connex box on the hospital loading dock. This is a requirement per the California Health and Safety Code, which states that a person transporting medical waste shall provide a form or a log to the receiving facility. The log at the receiving facility has to have, again, the name of the person dropping off the waste, the date, and the number of containers transported. So that log within the Connex box meets all those requirements. So when housekeeping comes and drops off regulated medical waste in the Connex box, they'll fill out this log. The log also includes the weight, which just kind of helps us internally. And then anytime the transportation department goes and picks up regulated medical waste from the clinics and drops it off at the Connex box, they will also fill out this log in the Connex box. Just for everyone's awareness, you'll never have to interact with this at all, but it's part of the environmental program manager's job description to sign off on a regulated medical waste manifest each time the waste contractor picks up the medical waste from the Connex box. So the environmental program manager receives a manifest from the contractor, approves it, and signs it each time Stericycle comes and picks up the regulated medical waste from the Connex box. And those records have to be retained for 3 years. So like I said, nothing you would have to interact with as the EPOC, but just for your awareness, that's one of the things that the environmental program manager is responsible for doing. Lastly, if you are a clinic, please, and you produce hazardous waste, please, please, please never ask the transportation department representative to take your hazardous waste for you. First of all, the clinic shouldn't be producing hazardous waste. They're not permanent for hazardous waste. But in the off chance that hazardous waste is generated at one of the clinics, please do not ask the transportation personnel like John or Fred or whoever services your area that works in the transportation department. Please do not ask them to pick up your hazardous waste for you. Hazardous waste, like I was mentioning before, is a completely separate program from the Connex box. Transportation department's main job is to pick up only medical waste from the clinics and drop at the Connex box. They are not supposed to be touching hazardous waste, and they haven't even undergone the proper training to pick up hazardous waste. So if you somehow, through some incidental experience, generate hazardous waste at the clinics, contact the environmental program manager for pickup. Do not contact the transportation department asking them to pick up that waste. Okay, DHA Form 147. So the DHA Procedures Manual 6050.01 is the DHA instruction for regulated medical waste. It mandates a monthly inspection of interim and final regulated medical waste storage areas documented on this form called DHA Form 147, Regulated Medical Waste Inspection Checklist. I don't want to say that this is a new requirement because the instruction is rather old, but it's new to our hospital. We previously haven't used this form, and this is a new part of the environmental POC or EPOC training. So please, please, please pay attention to this section of the training if you haven't filled out DHA Form 147 before and are unfamiliar with the form, which I would imagine most of you are. So environmental points of contact for departments or clinics, so both departments at the main hospital and clinics, you only need to fill out 2 sections of this DHA Form 147. Those sections are the Regulated Medical Waste Collection and Segregation Monthly Review and the Regulated Medical Waste Storage Monthly Review. So you only need to fill out those 2 sections. The other ones will be filled out by the environmental program manager at the hospital. The environmental program manager in charge of the whole environmental program. So you only have to worry about those 2 sections I've called out on this slide. So the Green Book, which we're going to talk about all this later, but the Green Book also mandates a monthly submission of Appendix A, which is kind of just like an internal audit of the environmental program within your department or clinic. You're going to submit this form along with Appendix A, but we'll talk about the requirements for Appendix A later on in this training. We'll talk about the Green Book in more detail later on in this training. So on the form itself is pretty self-explanatory. If you have any questions though, always refer to the EPM for help. Like, please do not hesitate to reach out. And I quickly want to mention that this form is also, it's only applicable if your department or clinic produces and stores regulated medical waste in an interim storage location. So I know some of the dental clinics produce regulated medical waste, but do not have an interim storage location for medical waste. A lot of the dental clinics will produce their regulated medical waste or whatever and bring it over to the medical side for storage. So if that's the case, my recommendation is that the medical clinic environmental point of contact on the medical side can complete the DHA Form 147 for both sides of the clinic, the medical and dental. However, please keep in mind that the medical EPOC has to go to the dental patient rooms and the dental side of the clinic to complete the monthly review in its entirety. If the medical EPOC is not willing to go inspect dental spaces, then we'll probably have to fill out 2 forms. Because that regulated medical waste collection / segregation monthly review section, that section talks about sharps containers in patient rooms and things along those lines. So it involves rounding the whole clinic. So if the medical EPOC is unwilling to round dental sides, then dental will also have to fill out their own form, even if they do not store regulated medical waste in their dental side of the house. If that's the case, and the dental would rather do a separate form, they can just mark NA for the regulated medical waste storage monthly review and just explain that the storage section is completed by the medical EPOC. So again, any questions, just ask the EPM. I've put a list there of the checklist items on the form that you might be able to mark not applicable to. For the first one, carts used to transport regulated medical waste within the facility are cleaned weekly with an EPA registered hospital detergent. This wouldn't really apply to any of the clinics because I don't think there's any carts that are used there. And at the main hospital, the operations and management department cleans all the carts. So that wouldn't be something that we would have to fill in for each EPOC. That can be NA. The second item talks about bags of regulated medical waste from the outlying clinics collected as required by local and state requirements. If you're at the main hospital, you can put NA for that. If you're a main hospital EPOC. If you're at one of the clinics, just mark yes. Because our transportation department does collect all regulated medical waste per local and state requirements. But for the main hospital, that'll be NA. The next item says regulated medical waste weight is recorded prior to being removed for disposal by a waste contractor. Everybody can put NA for that if you're an EPOC because our environmental program manager interfaces with the waste contractor and meets the requirements of the contract with that waste contractor. So nobody will need to deal with that as an EPOC. So you can put NA for that item. The last 2 items are not applicable to most departments and clinics, but may be applicable depending on where you work. So the chemotherapy and hazardous drugs waste is properly collected in rigid yellow containers. That would be NA unless you produce trace chemotherapy waste, in which case you would answer that question. So pharmacy departments would answer that question, but that's about all I can think of. The pathological wastes are refrigerated or frozen while awaiting pickup for disposal and disposed of within 30 days. That would be a question maybe only the main OR would answer if they had pathological waste during that month. Really quickly, because I forgot to mention this on the previous slide, a blank copy of DHA Form 147 is available in the training resources under the medical waste folder. So everyone has access to it and will submit it electronically along with Appendix A. And I'll get into more detailed instructions on how to do that later on during this training. When filling out the DHA Form 147, keep in mind the storage limit durations for the regulated medical waste interim storage locations. All regulated medical waste should be removed from the interim storage location within 7 days. And if it's a pathological waste, it needs to be removed from the interim refrigerator within 24 hours. So just keep those requirements in mind when you're filling out the DHA Form 147. Okay, moving on to how to restock disposal containers. So this slide is all encompassing for all types of waste, including regulated medical waste, non-regulated pharmaceutical waste, and hazardous waste, including RCRA pharmaceutical waste and universal waste. So this kind of touches on everything, how to get new containers for each of these different types of waste streams. So the warehouse centrally stocks sharps bins, non-regulated pharmaceutical waste bins, which are the blue and white bins, and the red bags for the hospital and Camp Pendleton clinics. So for all the centrally stocked items, your supply petty officer has to submit a purchase request in DMLS, Defense Medical Logistics Standard Support System, to obtain new bins that are centrally stocked. So I provided on the slide an example of a product ID for the 8-gallon floor sharps container, which is a product that is centrally stocked at the warehouse, and it's depicted there above that RCRA hazardous waste container. Make sure your supply petty officers request all restocks for red bags in DMLS The warehouse centrally stocks the red bags and orders them in bulk. And all the centrally stocked red bags have the proper ASTM certification label and the generator label, which is it's a county term for address label. So please make sure your supply petty officer orders from that central stock for red bags. Otherwise, you're going to receive red bags that don't have those required labels on them. So that's really important. If you're on Camp Pendleton and you're ordering red bags, you must be ordering from the central supply. The warehouse does not centrally stock trace chemotherapy or the red bins. So just order those and then make sure that they're meeting all the labeling requirements that we discussed previously. You can always reach out to the warehouse for any questions. A copy of these slides is going to be available for download in Relias. So if you look in the notes for this slide, I provided 2 email distribution lists. One is for the warehouse central supply, so you can ask any questions about those centrally stocked items that are discussed on this slide. And the other email address is for DIMLs, general DIMLs and ordering questions. So you can use both of those distribution lists to ask any questions if your supply petty officers don't know how to get a hold of any of those bins or disposal containers. Specifically for hazardous waste, and this includes RCRA pharmaceutical waste and universal waste, please do not try to order those yourself. Don't have your supply petty officer try to order those. Only obtain those hazardous waste disposal containers from the environmental program manager. Those disposal containers have specific ratings. They're essentially just special containers, and you can't just use any black bin for hazardous wastes, including RCRA, pharmaceutical waste, and universal waste. So please do not try to order those through DIMLs or order those yourselves. Just reach out to the environmental program manager who will provide those bins to you for anything hazardous or universal. Lastly, one more point of mention, that RCRA hazardous waste label shown in that image on the black container there, that's just a standard label that the container may come with. That label, that standard RCRA hazardous waste label, does not actually meet any of the base or state requirements for labeling hazardous waste. So if you receive a container that looks like that, you have to make sure to stick the proper hazardous waste label over that existing label. And we're going to go over in the next few slides about what that hazardous waste label is supposed to look like. But just know that that's not the right label. You have to stick the right label over that existing pre-populated standard label. We finally wrapped up our discussion on medical waste. So medical waste included regulated medical waste, non-regulated pharmaceutical waste, and trace chemotherapy waste. So medical waste was everything that was identified in orange in that introductory slide. So we finally finished our discussion on all the medical waste. And all the medical waste is taken away by the regulated medical waste contractor Stericycle from that final storage area in the Connex box on the loading dock. So now we're moving over to the hazardous waste side of the house. Hazardous waste encompasses RCRA pharmaceutical waste and universal waste. So we're moving over to the base side of the house. So hazardous waste is, the entire hazardous waste program is dealt with by the base. The base is responsible for final disposal of all our hazardous wastes from the central accumulation area. So the base is the one that helps us out with wastes falling under the hazardous waste umbrella. So what is hazardous waste? That is a very loaded question. So at the top of the slide there, I put 5 resources for understanding hazardous waste regulations. The top 3 resources are publicly available online. You can look up any of those. And the top resource, the Title 40 Code of Federal Regulations, that's where all the Resource Conservation and Recovery Act requirements are laid out. So those are all like code book, those are all like law essentially that we have to follow per federal regulations and per the state. Those last 2 resources, the Marine Corps Base Camp Pendleton Hazardous Waste Handler Course Student Guide and the Marine Corps Base Camp Pendleton Environmental Standard Operating Procedures, those are more useful to you as the EPOC. The Hazardous Waste Handler Course Student Guide goes into a good detail about hazardous waste handling and disposal requirements specific to the base and specific to the state of California. So I did save that in the training resources under the hazardous waste folder. If you're ever curious or have more detailed questions on hazardous waste handling and disposal requirements, please refer to that student guide. You can also always ask your environmental program manager. The Marine Corps Base Environmental Standard Operating Procedures are publicly available on the Marine Corps Base Camp Pendleton Environmental Security webpage. I provided the link to those standard operating procedures in the notes on this for this PowerPoint slide. So when you're able to download this PowerPoint presentation from Relias, you'll see in the notes for this slide a link to the ESOPs. I also provided instructions on how to access the EOPs in a Word document in the training resources under the hazardous waste folder. So you should be able to access those bottom two resources, and those ones should help you. The environmental standard operating procedures are especially helpful when it comes to disposing of universal waste, but they touch on hazardous waste disposal as well. So to define hazardous waste, it's defined in two ways. It's either explicitly listed or it exhibits a characteristic of hazardous waste. So the federal government defines listed hazardous wastes in that 40 CFR resource at the top. The 40 CFR separates listed hazardous wastes into the F, K, P, and U lists. Only the P and U lists will be applicable to Naval Hospital Camp Pendleton. The F list is for non-specific source wastes, so like wastes from common manufacturing and industrial processes, and the K list is source-specific wastes or waste from specific industries such as petroleum refining or pesticide manufacturing. So neither of those two lists are going to be applicable to the hospital. We only have to worry about the P and the U lists. The state of California adopts the listed hazardous wastes per RCRA, per Title 40 of the Code of Federal Regulations, but California also has more stringent definitions of hazardous waste and also has an additional M list. The M list is discarded mercury-containing products. We also don't really have any of those at the hospital. So pretty much the only two listed hazardous wastes applicable to the hospital are the P and the U lists. The P and the U lists are essentially discarded commercial chemical products. The P list identifies acute hazardous wastes, which are highly toxic. The U listed wastes are also toxic, but not as toxic as the P listed wastes. So that Article 4.1 down there in the middle bullet point, in the body of the middle bullet point, that's the article that calls out that additional M list. Article 4 is essentially a replication of the F, K, P, and U listed hazardous wastes per RCRA. But in addition to being listed, a hazardous waste may also be classified as such if it exhibits the characteristics of a hazardous waste. We're going to go over the characteristics of hazardous waste on the next slide. Essentially, the EPA or RCRA, they have definitions for each hazardous waste characteristic, and California makes those definitions even more stringent. So there's different levels of defining hazardous waste. The federal level is like the bare minimum for being a hazardous waste, and then California has a more stringent definition that encompasses more chemicals and makes more chemicals hazardous waste than per the RCRA Title 40 CFR definition. Also, per the state of California, used oil shall be managed as a hazardous waste. So just for purposes of simplicity, for the purpose of introducing hazardous waste, anytime you're wasting out a hazardous material, it will be wasted out as a hazardous waste. A hazardous material is any material that arrives with an SDS. If you have to waste out a material that has an SDS, it will be wasted out as a hazardous waste. A pharmaceutical waste meets the definition of a RCRA pharmaceutical waste if it has a sole active ingredient that is on the P or the U lists, or it exhibits the characteristics of hazardous waste as defined by the 40 CFR. Any pharmaceutical waste meeting the definition of, meeting California's definition of a hazardous waste So meeting the more stringent characteristics definitions of hazardous waste that we'll outline on the next slide, but not meeting the RCRA definition of hazardous waste is considered a non-RCRA California only hazardous pharmaceutical, and those may be managed as medical waste. And I previously mentioned that on the non-regulated pharmaceutical waste slides. Again, to reiterate, the Naval Hospital Camp Pendleton hazardous drugs list will identify any hazardous pharmaceutical that might be a RCRA pharmaceutical. Not all drugs on the hazardous drugs list are RCRA pharmaceuticals. Some are just chemotherapy. However, it does break down the ones that it does outline the ones that could possibly be RCRA pharmaceuticals. To reiterate, a hazardous waste is either explicitly listed as a hazardous waste or it exhibits one of the 4 characteristics of hazardous waste. So even if a waste is not listed as a hazardous waste, it may still be hazardous provided that it meets one of these definitions for one of these 4 characteristics. So the 4 characteristics are identified on the slide. They're ignitability, corrosivity, reactivity, and toxicity. The federal government, the 40 CFR, has definitions for each of these different classes of hazardous waste. And then California, the state of California, builds upon these definitions, makes them more stringent and more encompassing, and defines a hazardous waste based on those more stringent criteria. So the definitions on this slide are based on the California definitions. I read the 22 CCR Chapter 11 Article 3, and I grabbed these definitions right out of there. I've also, if you're ever curious as to what the definitions look like, I provided the link to that article so you can go and check them out yourself. Real quickly, we'll just go through the definitions. So hazardous wastes, if they're not listed, may still be hazardous if they display the characteristics of ignitability, corrosivity, reactivity, or toxicity. An ignitable hazardous waste is essentially anything that can be lit on fire. It's a liquid other than an aqueous solution containing less than 24% alcohol by volume and having a flash point less than 140 degrees Fahrenheit. Or it's a non-liquid capable of causing fire through friction, absorption of moisture, or spontaneous chemical changes under standard temperature and pressure. It's also an ignitable compressed gas or an oxidizer. The definition of corrosivity is essentially an acid or a base, or it's anything having the potential to corrode steel when it's mixed with water. Reactivity is any waste that is normally unstable or readily undergoes violent change. It's also any waste that would react with water. A toxic waste is a waste shown to pose a hazard to human health or the environment due to its carcinogenic properties, acute toxicity, chronic toxicity, bioaccumulative properties, or persistence in the environment. TCLP and WET. TCLP stands for Toxicity Characteristic Leaching Procedure. That's the test that defines a hazardous waste. That's the test that identifies if a waste is a toxic waste per the RCRA federal definition. So the TCLP is federal toxicity definition. WET stands for Waste Extraction Test. That's the California test to determine if something is a toxic hazardous waste. So if something is meeting the TCLP test for classification as a toxic waste, it's a federal toxic waste. If it's not meeting the TCLP test, but it is meeting the WET test for definition of a toxic hazardous waste, then it is a California only non-RCRA hazardous waste. Paint is an example of an ignitable hazardous waste. Acetic acid and broken lead acid batteries are examples of corrosive hazardous wastes. Lithium-ion batteries and chlorine tablets are example of reactive hazardous wastes, and pesticides and lead are examples of toxic hazardous wastes. Rather than trying to figure out if a waste that we're trying to get rid of meets one of these definitions, we're going to look at our SCS, guys. We're not going to try to like go through and see if our waste meets all these crazy definitions. What we're going to do is look at our SCS, and I'm going to get into that within the next couple of slides about how we're going to decide if a waste is hazardous, or which waste class it falls under is going to be shown on the SDS for the hazardous material that you're wasting out. This slide goes over how to label hazardous waste. Remember me mentioning before that RCRA hazardous waste label that might come on your black container, that's not appropriate. We're going to have to stick this hazardous waste label over that RCRA label that your container might come with. So this is how we label hazardous waste materials here on Marine Corps Base, hazardous waste on Marine Corps Base Camp Pendleton. All those highlighted fields on the hazardous waste label are the ones that you as the environmental point of contact are going to have to populate. The first few fields are pretty easy: the name, address, city, state, zip, and phone number. For that, you're simply going to stick the hospital address label across all of those fields. The hospital address label covers all the information required for those fields. A very important note is that the clinics are not permitted for hazardous waste generation. The clinics have small quantity medical waste registrations, small quantity medical waste generator registrations. So the clinics are only allowed to produce medical waste. There may be an off chance where a clinic produces hazardous waste, and we'll go over a couple scenarios where that might happen. However, if you have hazardous waste at your clinic, it needs to be picked up ASAP by the environmental program manager, removed within 24 hours as soon as possible, because the clinics are not permitted to actually store hazardous waste on site. So even the clinics, the environmental points of contact at the clinics should be using the hospital address label for the name, address, city, state, zip, and phone number fields. Don't use your clinic sticker there. Use the hospital sticker, because only the hospital is permitted to have hazardous waste. As a quick side note, because the clinics are only held to the medical waste county and state regulations, I've included in the training resources under the medical waste folder a inspection sheet that the county will go by if they ever come in one of your clinics and look. They're going to be using this form called the Certified Unified Program Agency, CUPA, Small Quantity Medical Waste Generator Inspection Checklist. So that checklist is saved in the medical waste folder, as I said, and that's everything that the county is going to be checking for from a state regulations perspective. So that's a very important form. If you're curious about what we're required by the county to do as a medical waste generator, that form has it all. So please, please, please go into the medical waste resources, training resources folder, and look for that CUPA inspection checklist. That's everything the county would be checking for if they come to one of the medical clinics to inspect. The medical clinics are allowed to produce universal waste, because universal waste is a less hazardous waste. So even though they're not permitted for hazardous waste, they can still produce universal waste. And like hazardous waste, please don't ask the transportation department representative to pick up your universal waste. The transportation department representative will only be picking up the medical waste. So please contact the environmental program manager even for universal waste. Don't ask the transportation people to haul that away if you're an EPOC at the clinics. Universal waste bins, you'll be able to use your clinic address label. Just on the hazardous waste bins, only use the hospitals, because like I said, the clinics are not allowed to produce hazardous waste based on their current small quantity medical waste generator registration. Moving on, previously we talked about interim storage areas for regulated medical waste and final storage areas for regulated medical waste. We don't call the storage areas by those names for hazardous waste. For hazardous waste, we call it a satellite accumulation area and a central accumulation area. The satellite accumulation area is where your clinic or department will intermittently store that hazardous waste until the environmental program manager is called and takes it to the central accumulation area. The central accumulation area is located, it's also known as a 60-day site, and it's located right by the warehouse. I think the building number is technically H139, but it's a little fenced-in locked area next to the warehouse in the transportation building. So just so you know, when the environmental program manager picks up waste from your hazardous waste interim storage area, which is technically called your satellite accumulation area, he will be taking it, or she, to the central accumulation area or the 60-day site over in the 27 area. So I just wanted you to be aware and understand that concept before we get into talking about this label. Because that satellite accumulation start date field, you as the environmental program manager will have to fill out that field. That field is the day that the first drop of hazardous waste or the first item of hazardous waste was deposited in the container. That accumulation start date to the right of the satellite accumulation start date, that's the date that the environmental program manager picks up the waste from the satellite accumulation area. So you as the environmental point of contact, as the EPOC, will never, ever, ever have to fill in that accumulation start date. You're only responsible for filling in the satellite accumulation start date to the left. And that's the date that you first put the first item or the first drop of hazardous waste in the container. The contents line should be populated with the common name of the hazardous waste or what the waste is contaminated with, if it's like a rag that you use to clean up a spill or something. So you're going to put on that contents line like what that is. So what's basically in that hazardous waste bin. So for certain wastes, the environmental SOPs on the Marine Corps Base Camp Pendleton Environmental Security webpage, those will dictate what the contents field must say for certain types of waste. For example, for solid materials like rags that have been used to absorb petroleum, oil, and lubricants, the hazardous waste label contents field must read debris contaminated with POLs. POLs standing for petroleum, oil, lubricants. So if you want to go through those ESOPs and read them, you can. But for the most part, for a lot of our toxic wastes and other hazardous waste that we're getting rid of at the hospital, they don't have any guidance on the ESOPs because we have very niche waste that we use here at the hospital. So pretty much the debris contaminated with POLs, facilities needs to be aware of that one. And that's kind of the big ticket one that I was able to find when I briefly went through the ESOPs. But like I said, feel free to dig through the ESOPs and see if anything pertains to you. But for the most part, that should be the only one. For the next hazard class highlighted field, we're going to go into detail on the next slide how you're going to pick that hazardous class. Those are those 4 characteristics of hazardous waste that we talked about on the previous slide. So your SDS is going to tell you which one of those characteristics your hazardous waste meets. So we're going to get into that on the next slide, what section of the SDS we should be looking at to determine what hazard class box to check. The last item on this waste label is the physical state. Again, you can find that information on the SDS, but if you're putting it in the container, you should probably know what physical state it is. Don't use the other physical state, guys. If you feel the need to use the other classification, please run that by the environmental program manager first. Lastly, I did forget to mention this. For the hazard class, it's base policy that we pick only one hazard class. Even if your hazardous material that you're wasting out falls in multiple hazard classes, you're going to only check the most severe hazard class. And we'll talk about that on the next slide as well. The department or clinic supply petty officer is responsible for purchasing any sticky paper for address labels, hazardous waste labels, and universal waste labels. So please keep in mind that is a supply petty officer function. There are templates for each of these labels provided in the training resources under hazardous waste folder. So you will have templates of these labels, but as far as getting the sticky paper, that's going to be on your supply petty officer. The environmental program manager does not provide sticky paper for the clinics or departments. This slide discusses safety data sheets. Every hazardous material is going to come with a safety data sheet, which communicates the hazards associated with the material. Safety data sheets are for hazardous materials, as I just said. But when you waste out a hazardous material, the resulting hazardous waste has the same hazards as the hazardous material that it came from. So you can use the hazardous material SDS to determine what hazard class the resulting hazardous waste will fall into. There at the top of the slide, the Globally Harmonized System of Classification and Labeling of Chemicals, abbreviated GHS, is a United Nations international standard to provide a consistent approach to classifying chemicals and communicating their hazards. So the GHS standardized the format for safety data sheets into 16 sections. So under the GHS, SDSs now have a standardized format consisting of 16 sections. I've listed the 16 sections on the slides. I'm only going to talk about a few of them. The first section is identification of the chemical, including the product name, manufacturer name, recommended use, and any restrictions on the use. Section 2 is highlighted in red because that's the section that you're going to use to determine what hazard class the waste resulting from the hazardous material falls into. So that hazards identification section, or section 2 of the SDS, will classify the hazardous substance into one of those 4 hazardous waste or hazardous categories: ignitability, corrosivity, reactivity, or toxicity. And it'll also have the GHS mandated label elements. Those label elements are essentially just photos conveying which hazard class the hazardous material falls into. And we'll look at pictures of those pictograms on the next slide. Section 3 of the SDS talks about the ingredients of the hazardous material. Section 6 talks about spill release procedures and any personal protective equipment or PPE required to clean up spills of that hazardous material. Section 7 and Sections 10 talk about incompatible hazardous materials. So any materials that would not be compatible to store with this hazardous material. The Section 7 also talks about safe handling practices and safe storage conditions, including any ventilation requirements. Particularly Section 8 talks about any personal protection required when working with this hazardous material or any exposure controls. Section 9 would contain the physical state of that hazardous material, which you should already know if you're interacting with the hazardous material in your workplace. Lastly, Section 15 talks about regulatory information, including reportable quantities. We're going to talk about reportable quantities later in this slide, so later in the slide deck. So that probably doesn't make sense right now, but essentially it's just a quantity above which you have to do some outside reporting if that chemical is released. So each department or clinic has to have an SDS binder, a safety data sheet binder, combining so that every single hazardous material that they use in their work area is combined. The safety data sheets for every single hazardous material used in the workplace should be combined in one binder, is what I'm trying to say. So the authorized use list is the list of all hazardous materials authorized for use by any command, unit, or activity. So each department or clinic is going to have an authorized use list, which identifies all of their hazardous materials that they're allowed to use within their department and clinic. So the SDS binder has to have the corresponding safety data sheet for every material listed on that authorized use list. So if you're wasting out a hazardous material, go find its SDS in that SDS binder before you fill out for aid in filling out that hazardous waste label. Again, Section 2 is where you're going to find the hazard class that hazardous material falls into. If you go through and read the Marine Corps Base Camp Pendleton environmental SOPs on that environmental security webpage, you will find that used oil and any debris contaminated with POLs, petroleum, oil, and lubricants, is considered toxic. So that'll be marked under the toxic category. Also, anything containing silver or heavy metals will be toxic. Here are the GHS label elements or pictograms that I talked about on the last slide. So section 2 of the SCS will have the most severe hazard pictogram leftmost on that section. So whichever pictogram appears leftmost under that section 2 will be the hazard class that you're going to mark for this hazardous material that you're wasting out. I grabbed this chart from the Hazardous Waste Handler Training Course Student Guide, so you can find it in there, and also you can download these PowerPoint slides for further reference, but this is the definition of what each pictogram means. We're now going to talk about requirements for storing hazardous waste. As I mentioned before, hazardous wastes, so anything with that hazardous waste label that we just discussed, hazardous wastes are stored in a satellite accumulation area. A lot of times, departments will combine their interim regulated medical waste storage area in the same vicinity as their universal waste or hazardous waste storage area, which is fine to do, but just realize that the difference in verbiage, a satellite accumulation area is specifically for hazardous wastes. The storage duration limit for hazardous waste stored in the satellite accumulation area is 180 days. So that whatever satellite accumulation start date that you put on your hazardous waste label, if the waste is getting to a point where it's reaching 180 days since that date, you need to contact your environmental program manager to come pick up that hazardous waste. Or if the container is 3/4 full, whichever comes earlier, if the container is 3/4 full or it's coming up on that 180-day mark, please contact the environmental program manager, the EPM, for transport of that waste to the 60-day site. As mentioned before, the 60-day site is also known as the central accumulation area. From the 60-day site or the central accumulation area, the base is responsible for final disposal of the hazardous waste. When the environmental program manager picks up the hazardous waste from the satellite accumulation area, he has 72 hours or 3 days to get that waste over to the central accumulation area or the 60-day site. In general, group together hazardous waste containers having the same hazard class. This will reduce the risk for storing any incompatible materials nearby each other. And as a rule, never mix hazardous waste in the same container, even if they're compatible. So each hazardous waste will have its own container. We'll talk about a tiny exception for RCRA pharmaceuticals later on, but as a general rule, never mix hazardous waste of different types in the same container. For any hazardous waste containers holding liquid waste, provide secondary containment. Ask the EPM if you have any questions on what that means, or if you need any help ordering secondary containment for hazardous waste containers. We're not allowed to accumulate more than 55 gallons of non-acute or general hazardous waste in a satellite accumulation area, and we're not allowed to accumulate more than 1 quart of acute hazardous or extremely hazardous waste in a satellite accumulation area. For the purposes of Naval Hospital Camp Pendleton, an acute hazardous material is anything on the P list. The P-listed RCRA list of hazardous wastes. Extremely hazardous is a California definition that makes it's a more encompassing definition of acute hazardous waste that California adopts. So an example of acute or extremely hazardous waste in a hospital would be warfarin and nicotine. So if you have either of those items or any other acute hazardous or extremely hazardous waste, you're not allowed to accumulate more than 1 quart of that item in the satellite accumulation area. So make sure the containers are just small enough and not able to accommodate more than that amount. The next bullet point talks about hazardous waste containers. As I mentioned before, hazardous waste containers are special. They have a UN rating that identifies their capabilities and allows you to determine if the container is suitable for storing a hazardous waste. So we're going to talk a little bit more about the UN rating on the next slide, but essentially the UN rating will indicate to you if a particular container is suitable for a hazardous materials packing group, physical state, and overall weight. A packing group is basically assigned to a hazardous material or hazardous waste based on the parameters of the material within a certain hazard class. So a packing group of 1 indicates a high danger product, a packing group of 2 indicates a medium danger product, and a packing group of 3 indicates a low danger product. So again, that product is assigned within a hazard class, and then there's certain parameters that material within the hazard class has to meet to be assigned a particular packing group. Lastly, we're going to keep all hazardous waste containers closed unless actively adding waste. We talked about this previously. Every single container that's in use should be closed unless waste is actively being added. In general, we should never be reusing hazardous waste containers. When the environmental program manager picks up your hazardous waste container, he'll take it to the 60-day site for final disposal, and essentially he or she will provide you a new hazardous waste container. There is an exception in facilities for empty containers that are used to store oil. The base picks up used oil from facilities management department, and when they pick it up using their vendor, we can reuse those containers again for used oil. So those containers have to be labeled used empty with the date the container was last emptied, and they must be reused only for the same hazardous waste previously contained. You're not allowed to reuse containers ever for corrosives. The containers must be used again within 1 year from the date they were last emptied. And if they're not used again within 1 year, they must be disposed of as a hazardous waste. Again, that won't apply to most EPOCs, but for the facilities environmental program and the facilities environmental point of contact, just be aware that you can reuse those used oil containers, provided that you label them used empty and store them away from any hazardous waste that's being accumulated, and store them separately from empty containers that are new. A couple other items of note for the facilities department: make sure to separate waste oil from used oil that the base can come reclaim. For oily rags, which should be labeled on the contents line as debris contaminated with POLs, put those in a 6 milliliter plastic bag inside a DOT approved container. DOT approved is simply referring to a container having the proper UN rating, which we'll discuss on the next slide. Make sure to seal the plastic bag before transportation of the waste to the 60-day site, and do not mix oily rags with rags contaminated with gasoline, solvents, or paint. For oil filters in facilities from the generators, make sure to place 1 inch of dry sweep at the bottom of the container to catch any remaining oil from the filters. This slide elaborates on the UN rating that I mentioned on the previous slide. So each hazardous waste container will be assigned a UN rating, and that UN rating will indicate to you what types of hazardous materials or hazardous wastes that the container can accommodate. So there's a different UN standard for solids versus liquids. The standard format for solids is on the left of the slide, and the standard format for liquids is on the right of the slide. That first group of numbers before that first slash is the packaging identification code. It just tells you information on the container itself. The second group after the slash, that's where you're going to find the information on the packing group that the container can accommodate. A packing group is assigned to a hazardous material or a hazardous waste based on that materials or waste's hazard class and different parameters that the waste or material might meet within its hazard class. So if you see an X behind that first slash, that means that the container can accommodate all packing groups from high to low danger. So 1 through 3. If you see a Y there, that indicates the container can only accommodate packing groups of medium and low danger. And if you see a Z, that means that only low danger or packing group 3 can be accommodated in that container. On the solid side, the number following the packing group in that middle portion between the 2 slashes, that indicates the maximum weight in kilograms that the container can accommodate. And that S after the second slash indicates that only solids are allowed to go in the container. For liquids, that number following the packing group is the specific gravity. You can't put any liquids in the container having a specific gravity higher than that one specified. If you want to know more information about the UN ratings, or you're curious about being able to interpret these ratings in greater detail, you can refer to the performance-oriented packaging handout under the training resources. However, just the main takeaway from this slide is that you can't just use any container for hazardous waste, and it must have the proper DOT approved UN rating. So please coordinate with the Environmental Program Manager, the EPM, to obtain hazardous waste containers if you run out. Looking at the pictures there on the slide, there's a closed top drum and an open top drum. The closed top drum is the one on the right under the liquids. Usually closed top drums are used for liquids. They just have a couple outlet holes, and so they'd prevent like spills being released in excess if the container were to fall over. The open top drum is that black drum on the left side, like the whole lid comes off. It doesn't just have those like little like outlet points. So you can just understand based on those pictures the difference between an open top and a closed top drum. Keep in mind that hazardous waste containers can pretty much be any color. They're usually blue, white, or black. And it's fine to use any color provided that the hazardous waste container has the suitable UN rating for the waste being contained. Never use anything besides polyethylene drums for corrosives, because corrosives will corrode a metal drum. And lastly, RCRA pharmaceuticals are disposed of in a black container. So just FYI, if you dispose of RCRA pharmaceuticals, if you work in the pharmacy, you will be using a black container for those. So the color does matter for the RCRA pharmaceuticals. This slide talks about RCRA empty versus California empty. The reason I'm including this is because this rule is one of the reasons why the clinics might produce hazardous waste in an off case, at which point it would need to be transported to the main hospital as soon as possible. So the federal government defines empty, a container being empty, as meaning that it has no more than 1 inch of residue of non-acute hazardous waste remaining. So that's how the federal government defines empty, no more than 1 inch remaining at the bottom of the container of non-acute hazardous waste. California decided to make things annoying and have their own definition of empty. So if there's 1 inch of residue remaining, the container is still full by California standards. So California says that for pourable materials, in order to consider the hazardous waste container empty, a stream is not observed when the container is inverted. And for non-pourable materials, including viscous materials like hand sanitizer, all wastes are removed by viable means such as scraping or wiping. So you'd have to wipe the hand sanitizer container out, and it has to look empty for it to be considered California empty. So for our purposes at our hospital complex, acute or extremely hazardous waste residues, such as from warfarin, will always be managed as a hazardous waste. There's no empty container exemption for acute or extremely hazardous wastes. So unless a liquid or viscous material meets this definition of California empty on this slide, the residual material must be managed as a hazardous waste. So if you have cavi wipes and there's still liquid at the bottom of the cavi wipes container, that's got to be managed as a hazardous waste. So this is why I bring this up. The clinics will likely experience situations where this would occur. So there is a time when the clinics would have hazardous waste produced as a result of this California empty stringent definition. Aerosol containers are a universal waste they're a universal waste as long as they don't contain a RCRA regulated hazardous waste. Provided that they don't contain a RCRA regulated hazardous waste, aerosol containers are considered California empty if they have been emptied of their contents and propellant to the maximum extent practical under normal use. That is, the spray mechanism was not defective and allowed discharge of all the contents, including the propellant. Please keep in mind the propellant must also be gone for aerosol cans to be considered California empty. So when you push the nozzle down, it has to make no sound. The best practice is to manage all aerosol cans as universal waste, provided that they don't contain a RCRA regulated hazardous waste. And we're going to go through on one of the following slides, how to dispose of non-empty aerosol cans not meeting the California empty definition. If they meet the California empty definition, you can technically throw them away, but like I said, it's best practice just to manage all aerosol cans as universal waste in accordance with the slide that we will go over later. Any container meeting the definition of California empty on this slide may be disposed of in a regular landfill, provided that it's 5 gallons or smaller. So earlier in the slides, I mentioned a tiny exemption to the rule of never mixing hazardous waste types in the same container. This slide touches on that tiny exemption. So the tiny exemption only applies to RCRA pharmaceutical wastes, provided that RCRA pharmaceutical wastes are compatible and they are not P listed or U listed. You may combine them into one black bin RCRA container. Definitely don't put P or U listed RCRA pharmaceutical waste together, and don't mix them with other RCRA pharmaceutical waste. Those ones should be isolated, the P and U listed ones. And this is due to the hazardous waste mixture rule, the RCRA hazardous waste mixture rule, which states that you have to treat hazardous waste as the most toxic hazardous waste in the container. So long story short, just keep the P and U listed ones separate from each other and separate from the rest of the RCRA pharmaceutical waste. Anytime you have RCRA pharmaceutical waste, you'll have to fill out one of these hazardous waste inventory logs, which are available in the Green Book. The table shown on this slide equates to table 12, TAC 5 in the Green Book. Whether or not you're combining RCRA pharmaceutical wastes, compatible RCRA pharmaceutical waste in the same container, use this log always for RCRA pharmaceutical waste per the hospital policy. As a general rule of thumb, never mix any ignitable, corrosive, or reactive RCRA pharmaceutical wastes. You can mix the toxic ones only if they're compatible, and the physical state will be solid for all of them. For all items that you do list on the inventory log, make sure to provide the SDS along with the inventory log for each item that's on there, and make sure to tape this inventory log to the black bin, the black RCRA bin, along with the hazardous waste label. Moving on to the universal waste section of the training. As previously discussed, universal wastes are hazardous wastes which are more common and pose a lower risk to human health and the environment than other hazardous wastes. Regulations pertaining to universal wastes are discussed in California Code of Regulations, Title 22, Division 4.5, Chapter 23. Universal wastes include batteries, mercury-containing equipment such as amalgam, lamps, electronic waste, and non-empty aerosol cans. The Marine Corps Base Camp Pendleton environmental SOPs separate batteries into 3 main categories: lead acid, non-lithium, and lithium. We'll discuss disposal requirements for each of those 3 battery categories in the slides that follow. The lamp types listed out there are also per the Marine Corps Base environmental SOPs. Any incandescent bulbs are actually not hazardous and can be disposed of in the regular trash. In general, light bulbs contain heavy metals at levels that are hazardous to human health. For electronic wastes, coordinate first with MID and also the environmental program manager. Oftentimes, electronic waste or e-waste can be disposed of by the Marine Corps Base Camp Pendleton Recycling Center if MID doesn't have a use for it or can't return it. Universal wastes may be stored in a satellite accumulation area for up to 9 months or until 3/4 full. Because universal wastes are less hazardous wastes, they extend the time limit, the storage duration time limit from 6 months to 9 months for universal wastes. This slide goes over how to label universal waste. The universal waste label is purple in color, and it's essentially a simplified version of the hazardous waste label. This time you're going to populate the accumulation start date with the date that the first universal waste item is placed in the container. Again, you can use the address label for the shipper, address, city, state, and zip fields. The clinics can and will produce universal waste and have their own address labels. So as promised, we're going to talk about battery disposal per the Marine Corps Base Camp Pendleton environmental SOPs. The two SOPs for battery disposal are non-lithium versus lithium. The non-lithium SOP also talks about disposal requirements specifically for lead acid batteries. So if you're ever in doubt about anything on these slides about batteries and lamps and aerosol cans disposal, please just go look at the ESOPs for the Marine Corps base on the Environmental Security webpage. Common types of non-lithium batteries include nickel, nickel cadmium, alkaline, metal hydride, and lead acid. Each different type of waste non-lithium battery must be segregated and stored separately. Don't ever mix battery chemical compositions. For any battery over 9 volts, tape the terminals. The terminals must be taped with non-conductive tape. Masking tape is non-conductive. Store non-lithium batteries in poly drums, never metal drums. Specifically for lead acid batteries, you don't need to use the universal waste label. These are the big, like automotive batteries. They're shown in that picture right there. So you don't need to use the universal waste label for those, but you do need to make sure that they're on a pallet, that you write bad on the battery along with the date it was wasted out. Tape the terminals with non-conductive tape and wrap them in shrink wrap once they're ready for disposal. Any damaged lead acid batteries become hazardous waste in lieu of universal waste, and they're going to be falling into that corrosive hazard class. So if you ever have a damaged lead acid battery, put on the contents line, damaged lead acid battery, stick a hazardous waste label on it, and manage it as a hazardous waste. The lead acid batteries shown in the picture there came from the Opman department, from their cleaning equipment, the machines. If you're ever confused about what kind of battery you have on hand, check the battery itself. It'll usually say on the battery what its type is. If you can't find enough details on the battery itself, you can always visit the manufacturer's website to determine what type of battery you have to dispose. For lithium batteries, common types of lithium batteries are listed there at the top of the slide. Even though they're all lithium, you still have to separate them into different containers based on their type. This is because it presents a fire hazard to mix lithium battery types in the same container. You may mix lithium ion and lithium polymer, but those are the only two lithium battery types that may be stored in the same drum. For all lithium batteries, regardless of the voltage, tape the terminals with masking tape, which is a non-conductive tape, and store lithium batteries in properly lined metal drums only. Properly lined just means just pick a regular garbage bag liner that fits the metal drum. To emphasize this, universal wastes must still meet the same UN rating standards as hazardous waste. In other words, all universal waste drums must still be Department of Transportation approved. Here's some photos showing examples of battery disposal. The first photo there on the left lists the contents as used batteries. That contents label has to identify the type of battery that's in the bin. Keep in mind that only non-lithium batteries can be put in the poly container. Lithium batteries have to go in the metal container, and we'll see an example of that metal container on the next slide. For the second image in the middle, it appears to contain alkaline batteries, and the container itself is fine, but it's missing a universal waste label. Since the container is approximately 3/4 full, at this point, you should call the EPM to have the EPM take this container to the central accumulation area. That third image, furthest on the right, is a container, it looks like, for lithium batteries. That's what's labeled on the contents field on the universal waste label. So this is incorrect because lithium batteries need to be stored in a properly rated metal container. I'll provide an example of a container to use for lithium batteries on the next slide. As a best practice, always put the specific type of the lithium battery on the contents line. The leftmost photo and the middle photo here show an example of a metal drum that may be utilized for lithium batteries. This container might be big for your department's or clinic's needs. Just coordinate with the environmental program manager to purchase a metal container that meets your needs for lithium battery disposal. The third image, the rightmost image, depicts a poly drum You can use polydrums for non-lithium batteries. You should use polydrums for non-lithium batteries. If you have a 55-gallon polydrum, fill it only 2/3 full due to the heavy weight associated with accumulating so many batteries in such a large container. For containers below 55 gallons, you can fill them up to 3/4 full before transport to the 60-day site. But again, just be mindful of that 9-month limit for storing universal waste at the satellite accumulation area. White drums are more commonly used for non-lithium batteries due to their smaller and more manageable size. This slide provides a quick crash course on light bulbs and aerosol cans disposal. For all those light bulb types listed there, the Marine Corps-based Camp Pendleton environmental SOP for light bulbs applies. If you have a light bulb type that's not listed there, reach out to the environmental program manager for guidance. You're going to separate light bulbs by type and store them in closed containers in a manner that prevents breakage. The best practice is always to just reuse the original packaging that the bulbs came in. Store broken bulbs separately, and those should also be segregated by type. Intact fluorescent, HID, sodium, and metal halide bulbs, the containers containing those should be weighed because those are charged per pound. Intact halogen and LED bulbs are charged per bulb, so count the number of them that are in the container and record the number on the container before removal of the container from the satellite accumulation area. For aerosol cans, those should be separated into different containers based on the hazard class of the material inside the can. When you go to dispose an aerosol can, remove the nozzle and discard it in the trash. If a stem remains when the nozzle is removed, replace the cap and thoroughly tape it so that the contents won't be released. Again, even if the aerosol can is considered California empty, it's a best practice just to dispose of all aerosol cans as universal waste. When you fill in the contents field for the universal waste label, distinguish between ignitable aerosol cans, corrosive aerosol cans, or toxic aerosol cans. Dental amalgam waste is the last type of universal waste that we're going to touch on. There's no environmental SOP per the base for this type of waste, but since it's a common universal waste in the dental clinics and hospital, I figured I'd include a slide on it. So amalgam is managed as a universal waste on this base. Dental staff are responsible for changing the chairside amalgam separators. Biomed, the biomedical equipment shop, is responsible for changing any central amalgam separators, and they may support with the chairside amalgam separators via training. So the biomedical equipment shop won't change your chairside amalgam separators for you, but they will provide training in the event that your department or clinic is confused on how to swap out the chairside amalgam separators. The DD 2011 chairside amalgam separator is the one that is procured for the clinics. The manufacturer's instructions for use mandate a change-out rate of between 9 and 12 months for these chairside amalgam separators. Different separators may have different change frequencies. Some of them are 6 months, so please just refer to your manufacturer's instructions for use for the chairside amalgam separator in your department or clinic. Always mark the change date on the separator so that you know when you last changed it, so that you know when you need to change it again, and ensure replacement within the required time frame per the manufacturer's instructions for use. Now we're going to be entering the portion of the training that talks about spill response procedures, spill prevention measures, and hazardous materials. This slide outlines where you want to keep spill kits, what spill kits you're going to need, and how you know what personal protective equipment you're going to need. As a general rule, put a spill kit anywhere hazardous materials are stored and in satellite accumulation areas containing hazardous liquids. Ensure appropriate decontamination equipment like an eye wash station per the SDS is also available. As discussed before, Section 8 of the SDS, Exposure Controls and Personal Protection, discusses personal protective equipment, and Section 6 of the SDS discusses spill response procedures for a chemical in question. There are different spill kits for different applications. There's 3 general types of spill kits, which are universal, oil, and hazmat. There might be some oil spill kits for facilities, but most of the ones at the hospital will be hazmat spill kits. Spill kits also do come in different sizes depending on the potential spill volume. Make sure to keep spill control and decontamination equipment within 10 feet of the container accumulation. Corrosive chemicals require an eye wash station within 10 feet. In the training resources, under the training resources folder, I've provided a basic spill instructions Word document. It's good practice to print this document and tape it to your spill kits. It reminds personnel of the general spill response procedures, so it's appropriate to have these basic spill response procedures taped on the spill kits. I'll discuss spill response procedures in the later slides. This slide goes over the contents of the spill kit, or what the spill kit might contain. Always make sure, guys, to compare sections 6 and 8 of the SDS to the PPE on hand or in the spill kit. The spill kit may not be appropriate for the chemical if the chemical lists in section 6 and 8 different PPE than what's contained in the spill kit. So make sure to cross-reference the SDS when you're looking at your spill kit contents. Common spill kit contents include absorbent pads and socks. The pads and the socks come in different colors for different types. Chemical spill kits typically have yellow absorbent pads. Not all absorbent pads are made of the proper material for absorbing different wastes, so that's why they indicate different types of pads with different colors. Spill kits will also often include disposable bags along with the ties and the container. So the container that the spill kit, the container containing the spill kit contents, can typically also be used for hazardous waste disposal once the spill is cleaned up. So in other words, those containers have the proper UN ratings and DOT approval to be used as the container for hazardous waste disposal following the spill cleanup. The spill kits will also include PPE, such as gloves and goggles. Specialty spill kits may have additional PPE like chemical aprons, Tyvek suits, and respirators. Gloves for spill cleanup have different chemical resistance depending on the chemical and glove material. So make sure to check the SDS section 8 for guidance on gloves. Gloves must be discarded as hazardous waste after using them for a spill cleanup. Spill kits will also include absorbent material like mercury spills, or neutralizing agents for acids and bases or formalin. They'll also likely include a mop or a broom with a dustpan. So on the right there, I've included a picture of the contents inside a chemo spill kit. As you can see, I've listed out each thing inside the chemo spill kit. It pretty much aligns one for one with the general spill kit contents to the left. The chemo sponge powder is a neutralizing powder for chemo waste. The chemo waste spill kit I've outlined there on that slide it's probably pretty big for the hospital's purposes. You can purchase smaller chemo spill kits with like one of each thing for smaller spill volumes. Make sure always to inspect spill kits monthly, along with completing Appendix A, which we're going to talk about. The hospital has a chemical spill contingency plan. The instruction number is Naval Hospital Camp Pendleton Instruction 5090.1. That instruction identifies locations in the hospital that require special spill kits. So special spill kits exist for formalin, battery acids, mercury, chemotherapy waste, and amalgam. There's also other ones for different chemicals. Dental should have an amalgam spill kit. Facilities management department should have an oil spill kit. OSHA approved battery acid spill kits are required in work areas where large, powerful batteries are present. So just keep in mind that there's different specialty spill kits for different types of things that can be spilled. Hazardous material storage. Make sure to store hazardous materials separately from hazardous wastes. Store hazardous materials in flammable and corrosive lockers. Flammables go in the flammable locker and the corrosives in the corrosive locker. Use the inventory sheet. So I have included a template inventory sheet under the training resources. So make sure to use that template and stick that log on the flammable or corrosive locker. So that log will basically list all the different types of hazardous materials there that are inside of the locker, along with the amount and the expiration date. So on a monthly basis, you're going to go through your hazardous materials lockers and make sure that there's nothing expired, and you're going to update the logs accordingly. Stick the inventory sheet on the outside of the flammable or corrosive locker. Do not store hazardous materials higher than eye level, and always store solid hazardous materials above liquids. So yeah, a good practice is just to always keep the hazardous materials in lockers so that they can never be stored higher than eye level, and put the solids on the top shelf. So Section 10, stability and reactivity, and Section 7, handling and storage of the hazardous materials SDS, will shed some light on any incompatible chemicals. So if there's any materials that are incompatible with the one that the SDS is for, those will be listed in Section 7 or 10. Section 7 talks about storage requirements in general, so it's a good idea to read that before you throw a hazardous material somewhere in storage. Make sure to just glance at Section 7 of the SDS. So we're going to start getting into hazardous substance spill response procedures. Spill response procedures apply to both hazardous materials and hazardous wastes and are outlined in Naval Hospital Camp Pendleton Instruction 5090.1 for our hospital. I put a copy of the 5090.1 spill response instruction under the training resources for this course. It's a little bit outdated, but still relevant. So before I talked about reportable quantities, a reportable quantity is a threshold above which a hazardous substance or chemical release is reportable. Reportable quantities are different for different chemicals. The Environmental Protection Agency has compiled a list of lists. The list of lists is a consolidated list of chemicals subject to release reporting under different pieces of legislation, such as the Comprehensive Environmental Response, Compensation, and Liability Act, or CERCLA. So the list of lists combines the reportable quantities for different chemicals that are mandated by different bits of legislation, and it combines them all into one document. So other examples of legislation that the list of lists pulls from includes the Clean Water Act and the Clean Air Act. Title 19 of the Code of California Regulations, Divisions 2 and 5, also outline reporting requirements for chemical releases and specify thresholds for hazardous material accumulation for certain chemicals. Here at the hospital, we will simply follow the Marine Corps Base Camp Pendleton Oil and Hazardous Substances Spill Contingency Plan. That spill contingency plan contains the guidance, that chart on the right-hand side of the PowerPoint slide. So for our purposes, we're going to use the base reportable quantities, which are outlined in that chart. In turn, once we report a spill to the base will be responsible for determining if any outside agency regulatory notifications are required and make those accordingly. So our only responsibility is to let the base know if we have a spill, and then the base will determine if the spill is reportable to the state or to the government or any other outside regulatory agency. Please keep in mind that the chart applies only to spills contained on land. Any spill entering a storm drain or water body, regardless of the size, must be reported to the base for outside regulatory agency reporting. So looking at the chart, any spill 1 gallon or larger, you should notify the environmental program manager so that the environmental program manager can let the base know about it. So this doesn't mean that you can't respond to the spill. If you have the proper training to respond to the spill, even if it's over 1 gallon and you have the access to the proper PPE, you may respond to that spill. However, 1 gallon is the point at which we have to start notifying the base so that they can make any outside regulatory agency notifications as required by law. Note that not all of the reportable quantities in the base's chart are actually regulatory. Some of them are just the base wants to know, and some are set as local standards, like by the fire department. That 5 gallon reportable quantity for gasoline comes from the fire department. So the hospital distinguishes between small and large chemical spills based on whether or not the department has the proper training and access to the proper PPE to respond internally to the spill. So at the hospital, we generally distinguish small and large at the 5-gallon mark. So anything under 5 gallons, the department should likely have the proper training and proper resources on hand to respond to the spill safely and appropriately. Anything over 5 gallons is likely classified as a large spill that we need to call on to the professionals to respond to. In general, make sure just to report all spills to the environmental program manager if they occur, and the environmental program manager will let the base know about the spill. Just take note that the greater than or equal to 1 gallon amount doesn't prevent you to responding internally to spills greater than that amount. You can still respond to a spill provided that you have the proper training and PPE to respond to the spill. But just make sure anything 1 gallon or larger gets passed on to the base. And like I said, in general, just let the environmental program manager make that determination. Let the environmental program manager know about all spills that happen, and the environmental program manager will liaise to the base if necessary. So if the spill is small enough such that you are comfortable within your department to respond to the spill, these are the procedures that you will follow. And like I said, we make the delineation roughly at 5 gallons. Anything under 5 gallons, your department should likely have the proper training and have the proper PPE on hand to respond to the spill safely. So if you're able to respond to the small or incidental chemical spill within your work area, these are the procedures that you're going to use. You're going to use the spill kit to immediately contain and clean up the spill. And you're going to contact the environmental program manager and safety manager once the spill is contained or partially cleaned up, and provide them the following information, including the description of the incident, the location of the spill, the chemical name and volume of spilled material, actions taken to minimize spill damage or isolate the area, and any remaining assistance requested. Once the spill is cleaned up, you're going to package and mark the cleanup waste. If you have any questions, obviously consult the environmental program manager, but you're going to package the spill cleanup waste using the previously discussed waste handling and labeling procedures for whatever type of waste that it is. So when in doubt, or if anyone is injured beyond first aid, treat the spill as an emergency. So even if it's under 5 gallons, if someone is injured or there's nobody in the work area with the proper training, you can use the large chemical spill response procedures that are going to be captured on the next slide. Again, you're going to use the large chemical spill response procedures captured on this slide anytime the spill is of a large enough volume that the work area personnel cannot safely respond to it, or if there's any question on appropriate response procedures. So if the work area personnel are lacking appropriate training, or don't have the PPE on hand to clean up the spill, you will resort to the large chemical spill response procedures, even if the spill is under 5 gallons. So the steps outlined here are: number 1, evacuate the area, set a perimeter to prevent other personnel from entering the area, and restrict sources of ignition if safe and if appropriate, such as shutting off medical gas or utilities. Just a side note there, any medical gas shutoff should be coordinated with the charge nurse or the clinical supervisor, and a notification should be made to the facilities management department. The 24-hour facility management department phone line is provided there. Step 2, call the quarterdeck, and during business hours, call the environmental program manager. The quarterdeck will be responsible for contacting the fire department and the PMO and make the code orange announcement. The fire department will in turn contact the Marine Corps Base Camp Pendleton Environmental Security Office, and that office will be responsible for contacting off-base regulatory agencies as appropriate. Again, if in doubt, you can fall upon these emergency chemical spill response procedures if you don't know how to respond and you feel like you need professional help. This slide lists the information to provide to the quarterdeck during the emergency chemical spill response procedures. You'll provide your name, department, and phone number, a brief description of the incident, the location and time of the incident, the name and quantity of the chemical spilled if known, the number and extent of injuries if applicable, and any general assistance requested. You should also include the current state of spill containment, or if any safety measures were already taken to either minimize injury or contain the spill. Hooray! Okay. Finally, we've finished discussing all the 4 area topics that the state and the base require us to include in this EPOC training. We're finally moving on to the last section of the environmental point of contact training, which discusses the hospital's environmental management system in the Green Book. The Naval Hospital Camp Pendleton is an EMS appropriate facility, meaning that the Navy requires us to have a local environmental management system. I've put on the slide right here a formal definition of the environmental management system, but essentially the environmental management system is there to ensure that we're not only meeting baseline regulatory environmental compliance standards, which we've discussed in all the slides leading up to this, but it is also there to create environmental awareness and generally reduce the hospital's environmental footprint. So essentially the EMS goes beyond just ensuring regulatory compliance and ensures generally that the hospital is doing right by the environment, which involves preventing pollution, conserving resources, and reducing waste generation. OPNAV Manual 5090.1, specifically Chapter 17, details all the requirements of an EMS. Per this chapter, the EMS must consist of 18 elements. The hospital has an environmental management system manual. It's a really lengthy document, and it's available on the Naval Hospital Camp Pendleton SharePoint. That manual includes the 18 elements that are required by Chapter 17 of OPNAV Manual 5090.1. The simplified version of the hospital's EMS manual is the Green Book. I've included a picture on the slide of what the Green Book within your department or clinic will look like. We're working on transitioning the Green Books from hard copy to electronic, and we're going to talk about how we're going to do that in the slides that follow. This EMS section of the training program will only address the elements or parts under the hospital's environmental management system that the environmental points of contact are responsible for or have input on. Lastly, for anyone who has taken the base hazardous waste handler course, they mentioned during the course the requirement for a site administration book. Please take note that the hospital has a centrally managed command site administration book that covers not only the main hospital, but also all the Camp Pendleton branch clinics. So if you attended the hazardous waste handler course and they told you about a site administration book, just be aware that the centrally managed one at the hospital covers the main hospital and clinics, and you don't have to have a separate site administration book at the clinics. If you have no idea what I'm talking about, that's totally fine. I just wanted to provide that point of clarification for people who have taken the hazardous waste handler course and may have been confused. This slide discusses EPOC maintained Green Book elements, or the elements of the EMS that the EPOCs are expected to interact with. If you will, let's define the Green Book as the EPOC interface with the hospital's EMS. Essentially, the electronic Green Book will contain all the elements of the EMS that the EPOC is required to maintain or have an input on. The first element of the EMS that the EPOC is expected to interact with is element 2, which is titled Leadership Commitment and Environmental Policy. The requirement of element 2 is satisfied by the commander's environmental policy statement. The base commanding general and the NMRTC Camp Pendleton commander both have an environmental policy statement. The EPOCs really aren't expected to interact with these policy statements at all. I've already uploaded both environmental policy statements to the environmental management points of contact teams page, which we'll talk about on the next slide. But I just want all the EPOCs to be aware that both the base commander and NMRTC Camp Pendleton commander have an environmental policy statement that is saved in the SharePoint site and available for viewing by all. So please, as an EPOC, just be aware that this policy statement exists and know where to access it on the SharePoint site. EPOCs also have to interact with element 4 of the EMS, which is titled Legal Requirements and Compliance Obligations. The capacity within which the EPOCs interact with element 4 is by maintaining the permit or medical waste registration. As previously discussed, each clinic has a medical waste registration, and the hospital has 2 permits, one for hazardous waste and one for medical waste and underground storage tanks. The environmental program manager will save to the Green Book's H200 folder a copy of the hazardous waste and medical waste permits for the hospital. If you're an EPOC at the clinics, make sure that you get a copy of your medical waste registration from the environmental program manager, and make sure that that's saved electronically to your virtual Green Book. And again, when we go over the virtual Green Book and the Teams page in the next slide, it'll all make sense as to where you're supposed to be saving these documents. The third element that the EPOCs will interact with under the EMS is element 6, titled Resources, Roles, and Responsibilities. So to satisfy this element, the environmental points of contact have to make sure their appointment letters are in the virtual Green Book. The next element that the EPOCs interact with is element 7, titled Competence, Training, and Awareness. The EPOCs will be responsible for making sure that their training certifications are available in the virtual Green Book. Again, in a future slide, I'm going to discuss how you can get that training certification and where you should be saving it within your electronic Green Book file folder. Okay, we previously talked about Appendix A. Appendix A is the Environmental Management System Self-Inspection Sheet, and monthly submission of Appendix A is required by the Green Book and the hospital's EMS. I put that Appendix A is an internal policy, but it's tied to Element 14. Element 14 in the EMS is titled Evaluation of Compliance. Essentially, Appendix A helps us evaluate our regulatory environmental compliance, because EPOCs are expected, when they complete Appendix A, to complete environmental rounds of their work areas within their clinic or department and identify any environmental discrepancies. When you submit Appendix A, please make sure that you're also submitting the corrective action log for identified deficiencies. The corrective action log is the backside of Appendix A. It's included in the Green Book. However, a lot of EPOCs, when they submit Appendix A, kind of forget that that backside exists. So please make sure when you submit Appendix A that you're also submitting the backside, which logs any corrective actions for deficiencies that were identified during the EPOC rounds. Again, we'll discuss Appendix A and submission requirements along with Appendix A in a future slide, but just know that when you submit Appendix A, you also need to be submitting DHA Form 147 if it's applicable, and the weekly hazardous waste storage area inspection checklist if it's applicable. As previously discussed, the DHA Form 147 is only applicable to departments or clinics producing or storing regulated medical waste in an interim storage area. Appendix B is crossed out here, and it was previously required under the Green Book to satisfy Element 3, which is titled Environmental Aspects, Risk, and Opportunities. Appendix B was titled the Departmental Environmental Aspect Inventory. It was essentially intended for each department or clinic POC to go through Appendix B and decide which environmental aspects pertain to their department or clinic. So on the slide, I put a definition of an environmental aspect. An environmental aspect is an outcome of a practice that can cause, in normal operation or upset mode, an impact to an environmental or other resource. Examples of environmental aspects include waste generation, air releases, or hazardous material use. In layman's terms, an environmental aspect is basically anything that the hospital does on its day-to-day operations that can cause an impact to the environment. We already discussed in an earlier slide the 3 significant aspects for the main hospital. All of our significant aspects are in the form of waste generation or waste streams, and they're solid waste, medical waste, and hazardous waste. So Appendix B was for departments and clinics to identify the environmental aspects within their work areas or internal to their departments or clinics. EPOCs previously submitted Appendix A annually to the EPM. The hospital will no longer use Appendix B at the department or clinic level and will now just have one aspect inventory for the whole entire Naval Hospital Camp Pendleton complex. So essentially, we're transitioning the responsibility for completing Appendix B from the department or clinic EPOCs to the environmental program manager. The environmental program manager will be maintaining an aspect inventory for the whole Naval Hospital Camp Pendleton complex. The Green Book and the EMS manual both require a comprehensive update, and all these changes will be captured when those documents are updated. But for right now, just please be aware, Appendix B is no longer a thing. Forget about it, scratch it, don't worry about it, is the main takeaway for that. The last item on this list is the authorized use list. So the EPOCs will be required to maintain and notify the EPM of any changes to the authorized use list. We'll go over the procedures to update or change an authorized use list later on in the slides, but just be aware that this is an EPOC responsibility. Again, the authorized use list is a list of all the hazardous materials that the department or clinic is authorized to use and store. In the authorized use list isn't specifically mentioned in one of the 18 EMS elements, but it is discussed in Chapter 23 of the OPNAV Manual 5090.1, and it is related to environmental aspect identification per Element 3 of the EMS. In general, Navy policy is to restrict HM procurement, hazardous material procurement, storage, and use. And the reason for this is because a lot of hazardous materials, if we over purchase them or we buy too much of them, we're going to have to dispose of that hazardous material. So hazardous materials become hazardous wastes. So essentially, we want to reduce the hazardous materials that we purchase so that we're wasting out fewer of those materials as hazardous wastes. Again, all this will become more clear on the next couple slides when we go through each of these items in detail. Quick correction from the previous slide. I believe I mentioned that EPOCs previously submitted Appendix A annually to the EPM. I meant to say Appendix B. Appendix A has always been a monthly requirement for submission and will continue to be a monthly requirement for submission. The EPOCs previously submitted Appendix B annually for department and clinic environmental aspect identification, but now we're doing away with Appendix B, so you no longer have to worry about it. But I just wanted to make that clarification that I did mean to say Appendix B was an annual requirement. Appendix A was monthly and will remain monthly. Okay, moving on to the EPOC SharePoint website. So hopefully this slide provides some clarity on how we're going to be organizing the documents that were required per the last slide. So when you're appointed as an environmental point of contact, you'll be given access to the Environmental Management Points of Contact SharePoint website. You'll also be added to an EPOC email distribution list. For any access-related questions to either of those things, please contact the Environmental Program Manager. So when you get access to the Environmental Management Points of Contact SharePoint website, there will be a subfolder, a folder within the Environmental Management Points of Contact folder titled Green Books. So if you click the Green Books folder, you're going to find the environmental policy statements in there. You might have to scroll down to the bottom below all those other folders that pop up in the Green Books folder. But yeah, just scroll to the bottom and you'll see the environmental policy statements for both the Base Commanding General and the NMRTC Camp Pendleton Commander in that Green Books folder. So you see that screenshot on the slide. If you were to click back out of 13 Area Dental and go to that Green Books folder, the environmental policy statements would be in there. So to access your Green Book for your clinic or department, on your SharePoint page, within the Environmental Management Points of Contact folder, navigate to the Green Books folder, click your building. It'll be H200 for all the hospital departments, or the clinic name for the clinics. If you're an EPOC at a hospital department, you'll have to subsequently click on your department name within H200. So that'll open your department or clinic's virtual environmental Green Book. The permits for H200 are saved in the H200 Green Books folder. So before you enter your department specific Green Book folder, those permits will be saved to that H200 folder. That'll be like the hazardous waste permit and the medical waste permit. An example of the virtual Green Book for 13 area dental is what's shown on this slide. However, everybody's Green Book has to be set up this exact same way. So let this slide serve as a template. These folders should be the exact same folders that you're going to see in every clinic's environmental Green Book. So don't screw around with the folders. This is how they all should look in every single clinic environmental virtual Green Book. The hospital Green Books will look the exact same minus the registrations folder. You don't need that registrations folder for the H200 departments Green Books because you're going to just have those permits that are saved in the H200 folder. So the only difference between the clinics and the main hospital is that the main hospital departments will not have that registrations folder. But everything else should be set up per this exact same template. Your clinic might be missing the registrations folder. I didn't get a chance to create that folder for all the clinics. So if your virtual Green Book for your clinic is missing that registrations folder, go ahead and add that, and then you'll obtain your current medical waste registration from the environmental program manager and put it in that folder. When you download the slides for this training from Relias, you'll find in the notes specifically for this slide the link to the environmental management points of contact SharePoint folder. You can follow that link, and if you don't have access, let the EPM know. He can give you access, or she. Got to make sure we're promoting equality, you know. This slide touches on EPOC appointment letters and training certifications, which are required by elements 6 and 7 of the EMS respectively. Important note at the top there, inform the environmental program manager of EPOC departures and new EPOC appointments. Anytime you're conducting EPOC turnover, please inform the environmental program manager. The environmental program manager has to grant the new EPOC access to the environmental management points of contact SharePoint site and add them to the EPOC email distribution lists. So please make sure you keep the EPM in the loop about who the current EPOC is for your department or clinic. Appointment letters for EPOCs. Appointment letter templates are saved in the training resources for this course under the EMS folder. They're also available on the environmental management points of contact SharePoint site. Draft the appointment letters. So when you're a newly appointed environmental point of contact, draft the appointment letter with your information. So the appointment letter templates have highlighted information, and that's the information that requires changes. So update those highlighted sections with your information and send the letter to the EPM for review. When the EPM reviews and approves the appointment letter, he or she will forward it to your department head for signature. Once it's signed, the letter should be uploaded to your department's or clinic's electronic green book in the appointments letters folder. So if you're the EPOC for a clinic or department, just make sure that your current appointment letter signed by your department head is in the appointment letters folder in your virtual Green Book. Please note too that there are different appointment letter templates for the hospital and clinics and for the primary and alternate EPOCs. If you're an alternate EPOC at the clinics, use the clinic alternate EPOC template. If you're a primary environmental point of contact at the clinics, use the clinic primary EPOC template. Just make sure you're using the right template for your role. Also note that having a secondary or alternate EPOC is optional. However, if your department or clinic does decide to appoint an alternate EPOC, the alternate EPOC must have an appointment letter and training certificate. So the alternate environmental points of contact have to still meet the same requirements as the primary environmental points of contact if your clinic or department decides to appoint one. That third bullet point there provides instructions for how to obtain the EPOC training certificate. You can print the training certificate from Relias after successful completion of this course. This course serves as your EPOC training. Please note you're going to be required to have a 100% test score to pass, but you will get multiple attempts. Once you have passed the course and printed it out from Relias, upload the certificate to the training certs folder in your department's or clinic's virtual greenbook. Just to let you guys know, the EPM has administrator access to Relias, so the EPM can see who has completed this course and who hasn't, and will be maintaining a training hit list. Appendix A. Okay, kind of beating this one like a dead horse, but EPOCs must complete Appendix A, the EMS self-inspection sheet, monthly and upload it to the proper Appendix A folder in the virtual greenbook. The Appendix A folders in the virtual greenbook contain subfolders for each month in the calendar year. Upload Appendix A to the year and month folder to which it corresponds. Appendix A forms are due before the last day of each month. You can find a blank copy of Appendix A in the greenbook. I've included a Word document version of the greenbook under the EMS folder in the training resources. As I've mentioned before, Appendix A includes a second page with the deficiencies listing and a corrective action log for those deficiencies. Please don't forget to include that back page when you upload Appendix A into the SharePoint site in your virtual greenbook. Even if it's blank, include it anyways, just for completion of the entire form. Also, don't let Appendix A limit you. If you're rounding your spaces in the completion of Appendix A and you also come across an identified deficiency that's not captured under one of the checklist items on the first page of Appendix A, please still write it down. You can write it down on the back page and identify a corrective action along with it as well. So don't let Appendix A limit you. If there's something that you identify that you can't categorize into one of those checklist items on the front page, still write it down there on the back page. Importantly, and also mentioned before, you will be uploading along with Appendix A and into the Appendix A folder the weekly hazardous waste storage area inspection checklist and DHA form 147 if these forms are applicable. The weekly hazardous waste storage area inspection checklist is only required for satellite accumulation areas storing hazardous waste. So that's any waste with that hazardous waste red and white label. The clinics will never have to submit that form because the clinics don't store hazardous waste. But if you're a hospital department that has a satellite accumulation area with hazardous wastes in there with that red and white label, you'll be required to fill out that inspection checklist as well and submit it along with your Appendix A for that month. This slide shows the front page of Appendix A. Real quick, we're just going to touch on some of the items on the Appendix A checklist. In general, though, if you have any questions, you can always ask the Environmental Program Manager. So that first section of Appendix A titled Housekeeping, just keep in mind that good housekeeping correlates to environmental compliance. If you leave rusting equipment outside or allow stagnant water to pool, those will result in environmental findings. So just essentially walk your clinic and make sure that equipment, tools, and buckets are put away. Good housekeeping and environmental compliance go hand in hand. For item 4 on the Appendix A front page mentions water flushing logs. Water flushing logs are part of a separate program, not part of the environmental management system, and should be held locally at the hospital department. However, you don't actually need to put the logs in the green book, so that's kind of an old item. And like I said, we need to revise the entire environmental management system manual and green book for the hospital. So that's just one of those examples of outdated information in there. However, please, if you are an EPOC at the main hospital, ensure that you are maintaining flushing logs and maintaining those locally within your department. And you can answer that question as yes, provided that you are doing those things. But like I said, you don't have to put those records in the environmental green book. Item 13 talks about filling out the weekly inspection of the hazardous waste storage area, if applicable. That's that hazardous waste weekly inspection sheet that I mentioned on the previous slide when I talked about Appendix A. I'll show you that sheet on the next slide, but essentially you only have to fill that out if you have a satellite accumulation area. Item 15 talks about compatible materials. Again, refer to the SDS sections 7 and 10 to determine incompatible materials before storing hazardous materials. So before storing any HM, make sure that they're compatible with each other. Item 19 talks about light bulbs. It asks, are light bulbs collected by or turned into facilities? Again, this is an old news line item. Facilities will not collect light bulbs for your department or clinic. You, as the EPOC for your department or clinic, are responsible for following the guidance per this training and per the base environmental standard operating procedures to dispose of light bulbs. So you can just put NA for that item for everybody. Item 22 asks if electronic wastes are taken to MID. Always inquire with MID first, but if necessary, consult the EPM to help you with disposal of electronic wastes. The base recycling center can take a lot of electronic waste, so if you're struggling with MID, always just ask the EPM for questions on that. Item 25 says, can emergency or spill response documents be located? Remember, we had talked about Naval Hospital Camp Pendleton Instruction 5090.1 for spill response procedures. That's available in the training resources for this course and also on the Naval Hospital Camp Pendleton SharePoint website. The EPM also holds the Consolidated Emergency Response Contingency Plan at the main hospital. The Consolidated Emergency Response Contingency Plan, CRCP, shows satellite accumulation areas within the hospital and clinics and details site-specific emergency response procedures. So just be aware that the CRCP is a thing, and it's part of the site administration book that's centrally managed at the main hospital. And the CRCP covers the Naval Hospital Camp Pendleton complex, including the main hospital and the clinics. So just be aware that the site administration book that I mentioned earlier does contain that Consolidated Emergency Response Contingency Plan, and that's on site with the EPM at the main hospital. Item 27 talks about training. It asks if employees are familiar with the environmental policy and if employees have been trained on the EMS. Please note that as the EPOC, you must be available to train the staff in your department or clinic on environmental policies, including the location of the Naval Hospital Camp Pendleton environmental policy, which is in the Green Books folder on the environmental management points of contact SharePoint site. Importantly, don't just put the right answer, guys. Answer honestly and put all identified deficiencies on the back page of Appendix A with the corrective action plan to address the deficiency. You really want to use Appendix A as a tool to check the environmental compliance within your department or clinic and work on resolving any deficiencies identified. So don't just put the right answer, be honest, answer honestly, and try to work on those issues that you do identify within your department or clinic, and engage the environmental program manager with any questions or as necessary to elevate any deficiencies that cannot be handled at your level. As promised, this slide shows the weekly hazardous waste inspection sheet. You only need to fill out this sheet if your department stores hazardous waste. That is, if your department has a satellite accumulation area. None of the clinics will have a satellite accumulation area because the clinics are not permitted to store hazardous waste. So this form will only be used for the main hospital if your department stores hazardous waste. That's anything labeled with that red and white hazardous waste label that we discussed earlier in the training. This form is a base requirement, a requirement per the base environmental standard operating procedures. If you have any questions on how to fill it out, please contact the environmental program manager. The form itself is pretty self-explanatory. There is one item that says secondary containment liquid free. That essentially means any secondary containment underneath a hazardous material or excuse me, a hazardous waste container cannot have liquid in it. So those have to be, the secondary containment underneath those containers has to be liquid free and clear of debris. Again, any questions on form applicability for this form or the DHA form 147, reach out to the environmental program manager. One quick last note about lack of hazardous waste at the branch clinics and Appendix A. Items 11 through 13 on Appendix A talk specifically about hazardous wastes, you can mark all 3 of those items, 11, 12, and 13, on Appendix A as not applicable for the branch clinics because the branch clinics do not produce or store hazardous waste. Moving on to authorized use lists. As previously discussed, the authorized use list identifies the hazardous materials authorized for order, issue, storage, and use at the department or clinic. Requirements pertaining to AULs are discussed in OPNAV Manual 5100.23, the Navy Safety and Occupational Health Manual. That manual requires an annual review of AULs. It also requires the AUL to include the national stock number, national item codification number, or local stock number, item name, and manufacturer contact information for each hazardous material listed on the AUL. As the EPOC for your department or clinic, it's your responsibility to make sure that the AUL hazardous material listing aligns 1-for-1 with the SDS binder. That means that any chemical listed on the AUL must have an SDS available with a safety data sheet available within the SDS binder. Again, per the Navy's hazardous material minimization policy, all attempts should be made to eliminate the use of hazardous materials or substitute materials for a less hazardous material. In general, reduce hazardous material purchases to avoid having to waste out chemicals as hazardous waste. OPNAV Manual 5090.1 and Naval Hospital Camp Pendleton Instruction 5100.6, which talks mostly about safety stuff, both of those instructions state to store less than a 7-day supply of hazardous materials at the work area. The 7-day supply definition can be pretty arbitrary as it depends on patient loads through the department and the clinic. Therefore, in general, it's recommended to reduce procurement, storage, and use of hazardous material products to the minimum quantity necessary to perform assigned task. So please keep HM to a minimum and only store it in quantities necessary to meet the mission requirement. Additionally, AULs must be updated anytime a change is required. So anytime a chemical is added, substituted, or removed, you must update the AUL. To add a chemical to the AUL, you'll use the new item request process. Essentially, AUL additions must be routed through the hazardous material manager, safety manager, infection control, and industrial hygiene for approval before submitting in DIMLs. If you submit in DIMLs a request to purchase a hazardous material and you haven't yet run it through that new item request process, that will only result in delays to the approval. So please run it through that new item request process before you submit it in DIMLs for approval by supply. If you have any questions on the new item request process, you can email that email distribution list for DIMLs that I provided earlier. I also provided it again on this slide. If you download the training slides, you can look in the notes, and the email distribution is listed again here on this slide in the notes. Also, there's a new item request go by in the training resources folder under the EMS subfolder. So you can also refer to that new item request guide in there. That guide is a little bit old, but the process is generally the same, and it tells you who you have to route the request for an addition. For a hazardous material addition to the AUL, it will show you who you have to route it through to get that approved. The AUL will be stored in the AUL folder in the electronic green book. When submitting AULs for the annual update, upload them to that AUL folder in the electronic green book, and the hazardous material manager will review it in there virtually. If changes are required, just put your markups on the existing AUL, and the hazardous material manager can review those markups. However, keep in mind that for anything you've marked up to add onto the AUL, you must have routed it through the new item request process. Congratulations, guys. It's official. You made it through the environmental point of contact training. On this last slide, I provide information on who you can reach out to with questions. So Under the training resources, refer to the Naval Hospital Camp Pendleton Environmental Program Points of Contact handout. That handout will list the current environmental manager program staff and hazardous material manager staff at Naval Hospital Camp Pendleton. Please consult those individuals with questions. I am PCSing on June 4th, so you can reach out to me, but I probably won't answer. So everyone on those environmental program points of contacts list will be the people that you need to reach out to. Mr. Kenneth Hensley's information is also on there on that environmental program points of contact handout in the training resources. Please, if you're an environmental point of contact at the main hospital, reach out to him to get your recycling bin. Like I said, that you're going to be the OIC of that recycling bin, and you're going to maintain ownership of that recycling bin. And you, as the environmental point of contact at the hospital, will be responsible for educating the staff within your department on what can be disposed of within that recycling bin. And you will also be responsible for taking that recycling bin waste to the loading dock and dumping it in those blue 96-gallon bins. If you have any questions, reach out to the environmental program managers listed in that points of contact Word document, or you can reach out to Mr. Ken Hensley. He can help you. It's been a pleasure providing this training to you. Thank you so much for your attention. I apologize for the length of the course. It's a lot to talk about in a short period of time. I hope this training helps you, and I wish you the best in your collateral as the environmental point of contact.